we are waiting for them. All the volunteers are, please instruct the delegates to sit. All students are requested to sit.
बहुत ही भव्य कार्यक्रम होने वाला है। 3 दिन की जो वर्कशॉप है, अंतर्राष्ट्रीय वर्कशॉप सेमिनार, उसका इनॉग्रल सेशन। हम सब भाग्यशाली हैं कि उत्तर प्रदेश के मुख्य सचिव श्री दुर्गा शंकर मिश्र जी स्वयं हमारे, जब माननीय मुख्य सचिव महोदय इस कक्ष में पधारेंगे तो हम सब तालियां बजाकर उनका जोरदार स्वागत करेंगे, खड़े होकर तालियां बजाएंगे और उनके मंच पर आसीन होने के पश्चात हम सब वापस अपना स्थान ग्रहण करेंगे। साइंसेस के सभागार में पधार चुके हैं मित्रों। आज हम सब के लिए बेहद गर्व का क्षण है कि उत्तर प्रदेश शासन के मुखिया, उत्तर प्रदेश के माननीय मुख्य सचिव महोदय स्वयं समर्पण इंस्टीट्यूट पधारे हैं और हम सबके बीच में हैं। आज मंच पर आ रहे हैं और समर्पण इंस्टीट्यूट का जो 3 दिन की ये वर्कशॉप, जो 3 दिन की सेमिनार आयोजित है, अंतर्राष्ट्रीय सेमिनार, उसके माननीय मुख्य अतिथि महोदय हमारे बीच पधार चुके हैं, मंच पर हैं। देखो, आज मंच पर जो 2 विभूतियां हैं, डॉक्टर RS दुबे और श्री DS मिश्रा जी, उनके बारे में संक्षेप में आपको बताना चाहूंगा। ये दोनों विभूतियां, आप सभी अपना स्थान ग्रहण कर लें। ये दोनों विभूतियां उत्तर प्रदेश के ग्रामीण अंचल से निकली हैं। डॉक्टर RS दुबे जो हैं, वो चिकित्सालय है, उसको उन्होंने वर्ष 2010 में देश का पहला ऐसा सरकारी अस्पताल था जिसको NABH प्रदेश का पहला संस्थान बनाया है, वो मंच पर विराजमान है। और हमारे बीच जो माननीय मुख्य अतिथि हैं, उनके बारे में संक्षेप में आपको बता दूं कि मऊ के एक छोटे से गांव पहाड़ीपुर में उन्होंने जन्म लिया और प्राइमरी जो उन्होंने वहां से की है वो 1.5 कमरे का, मात्र 1.5 कमरे का स्कूल था मित्रों। और उनकी कक्षाएं प्रायः स्कूल के बाहर पेड़ के नीचे लगा करती थी। छोटी उम्र में उन्होंने घर में एक पुस्तकालय बनाया था जिसका नाम स्वस्ति पुस्तकालय था और उसके बाद छात्रवृत्ति से रांची में उन्होंने पढ़ाई की। आज हमारे इस कार्यक्रम के मुख्य अतिथि हैं, उनके बारे में हम सिर्फ यही कह सकते हैं कि है समय नदी की धार कि जिसमें सब बह जाया करते हैं, है समय बड़ा बलवान, प्रबल पर्वत झुक जाया करते हैं। अक्सर दुनिया के लोग समय में चक्कर खाया करते हैं, लेकिन कुछ ऐसे होते हैं जो इतिहास बनाया करते हैं। ऐसी 2 विभूतियां हमारे बीच उपस्थित हैं। मैं अनुरोध करूंगा माननीय मुख्य अतिथि महोदय से कृपया दीप प्रज्वलन कर इस कार्यक्रम का प्रारंभ करें और डॉक्टर RS दुबे से अनुरोध करूंगा कृपया दीप प्रज्वलित करें और उसके पश्चात मां से ये हमारा परम सौभाग्य है कि आज जो समर्पण इंस्टीट्यूट ऑफ नर्सिंग एंड पैरामेडिकल साइंसेज में बात देवी सरस्वती की कृपा अगर हमारे जीवन में हो जाए तो हमारा जीवन धन्य हो जाता है। और जो 2 विभूतियां मंच पर हैं, इन दोनों पर मां सरस्वती की कृपा रही है, विशेष कृपा। और अब समय है सरस्वती वंदना का।
सिखाती है, कदम दबा के तू कमियों से प्यारी रीत लिखाती है, प्यारी गिर पर हाथ धरो माँ, ज्ञान की ज्योति जगा देना, ज्ञान की ज्योति जगा देना।
बहुत बहुत धन्यवाद आपका। और अब इस इनॉग्रल सेशन के आगे के संचालन के लिए मैं सुनंदा को आमंत्रित करता हूं। सुनंदा कृपया मंच पर आएं।
Thank you so much, sir. So, moving forward, now. Thank you, sir. Now,
मंच पर विद्वान आदरणीय मुख्य अतिथि महोदय, हमारे समक्ष उपस्थित सभी सम्मानित गणमान्य अतिथियों, पहले मैं अपनी तरफ से समर्पण परिवार तथा इस संगोष्ठी के आयोजक मंडल की तरफ से इस अंतर्राष्ट्रीय कॉन्फ्रेंस के उद्घाटन सत्र के मुख्य अतिथि माननीय मुख्य सचिव उत्तर प्रदेश सरकार परम आदरणीय श्री DS मिश्रा जी का हार्दिक स्वागत और अभिनंदन करता हूँ। हम सब अपने आप को गौरवान्वित महसूस कर रहे हैं और हर्ष का अनुभव कर रहे हैं कि आपने अपने व्यस्ततम बहुमूल्य समय से कुछ क्षण निकालकर यहाँ पधारने की अनुकंपा की और हम सबको आशीर्वचन देने के लिए आप यहाँ पधारे हैं। हम सब जानते हैं आप बहुमुखी प्रतिभा के धनी हैं। अभी प्रकाश जी ने बताया आपके बारे में, हम सबको जानकर बहुत प्रसन्नता हुई और हमें उम्मीद है कि आपने जिस प्रकार अपने करियर में तरक्की की है, हमारे जितने छात्र छात्राएं बैठे हैं ये आपसे प्रेरणा लेंगे और आगे बढ़ने का प्रयास करेंगे और अपने जीवन में उच्च शिखर तक पहुंचेंगे। आपका 39 वर्षों का एक लंबा दीर्घकालिक प्रशासनिक अनुभव केंद्र सरकार और राज्य सरकार में विभिन्न पदों पर रहा है और आपके उस अनुभव से आप जो विचार और सुझाव हमको देंगे उससे हम सबको आगे बढ़ने की प्रेरणा मिलेगी। मैं मंच पर विराजमान समर्पण ग्रुप के अध्यक्ष आदरणीय डॉक्टर RS दुबे साहब, इस कॉन्फ्रेंस की चेयरपर्सन डॉक्टर दीप्ति शुक्ला, फॉरेंसिक साइंस फॉरेंसिक नर्सिंग के इस देश में जनक डॉक्टर प्रोफेसर गुराया साहब, डॉक्टर रामू हमारे सामने विराजमान। जो ये 3 दिवसीय अंतर्राष्ट्रीय संगोष्ठी है, इसमें विभिन्न तकनीकी सत्र जो होंगे उसमें जो की नोट स्पीकर हैं, उनके जो चेयरपर्सन हैं, उन सबका भी मैं हार्दिक स्वागत और अभिनंदन करता हूं। इस कॉन्फ्रेंस में जो वक्ता हैं वो विदेश से भी हैं, देश से भी हैं, साथ ही साथ हमारे साथ बहुत सारे लोग जुड़ेंगे, ऑनलाइन हैं, ऑफलाइन हैं। मैं यहाँ पर जितने नर्सिंग कॉलेज हैं, नर्सिंग कॉलेज के बहुत सारे ओनर्स हमारे समक्ष बैठे हुए हैं, उनके प्रिंसिपल्स आए हैं, संकाय सदस्य हैं, उनके छात्र छात्राएँ हैं। मैं उन सब का अपनी तरफ से, समर्पण परिवार की तरफ से और कॉन्फ्रेंस मैनेजमेंट कमेटी की तरफ से हार्दिक स्वागत और अभिनंदन करता हूं और आशा करता हूं कि जो 3 दिवसीय डेलीब्रेशंस होंगे उनमें जो भी शोध पत्र पढ़े जाएंगे, जो भी हमारे कीनोट स्पीकर्स होंगे, जो अपने विचार साझा करेंगे, उससे आप सबका अवश्य ज्ञानवर्धन होगा। इसके साथ ही साथ मैं इस कॉन्फ्रेंस में हमारे जितने भी प्रिंट और इलेक्ट्रॉनिक मीडिया के भाई हैं, उन सबका हार्दिक स्वागत और अभिनंदन करता हूं कि वो हमारे अनुरोध को उन्होंने स्वीकार किया, वो यहाँ पधारे और इस 3 दिवसीय कॉन्फ्रेंस को वो अपने मीडिया के माध्यम से एक बृहद कवरेज प्रदान करेंगे, जिससे नर्सिंग क्षेत्र में क्या कार्य हो रहा है, क्या शोध हो रहा है, किस चीज़ की चीज़ें आगे आ रही हैं, वो जनमानस तक पहुँचेंगी और जो हमारे समाज के अन्य लोग भी हैं, जो बच्चे हैं, वो इस सेवा में आगे आने के लिए अग्रसर होंगे। मैं ज़्यादा समय नहीं लूँगा। इन्हीं शब्दों के साथ मैं इस सभागार में उपस्थित सभी माननीय अतिथियों और गणमान्य व्यक्तियों का एक बार पुनः इस संस्थान की तरफ से, इस परिवार की तरफ से स्वागत और अभिनंदन करता हूं और आशा करता हूं कि आप सबके सक्रिय भागीदारी से यह कॉन्फ्रेंस अपने उद्देश्यों को प्राप्त करने में सफल होगी। धन्यवाद, नमस्कार, जय हिंद, जय भारत।
Principal Ma'am Dr. Deepti Shukla, and also she is the organizing chairperson of this conference, to unfold the theme of the conference.
Jai Hind. And a very gracious morning to our respected chief guest and all the highest UCI scoring 97% around the UP by Government of UP under the marvelous program of named Mission Niramaya. We are also one of the mental institute recognized by Government of UP under the Mission Niramaya. This 3 days conference is going to be complete and focusing on the modern and burning topics of nursing. The UP Nursing Council announces 0 age credit points for this conference, and Trade Nursing Association of India also announced 8 credit points for this conference. We are fortunate to have our eminent speakers such from Australia, USA, Philippines, Saudi Arabia, Nepal and Russia. We have national speakers from Karnataka, Gujarat, Delhi, West Bengal, Kerala, Maharashtra, Rajasthan, Uttar Pradesh, Uttarakhand, Himachal Pradesh, Haryana and Tamil Nadu. We are having delegates from Russia, China, Nepal, Bangladesh, Netherlands and India. We are also having so many beneficiaries. They are the scholars, PhD scholars, masters, graduate and diploma in nursing fields. So by seeing all this, we can say this conference is going to be graced a lot and giving so much of rich information and knowledge regarding the theme. So with this, once again I thanks each and everyone presenting here and graces this occasion. Thank you so much.
Request our founder and chairman of the Samarpan Group, Dr. R.S. Dubey, to address the gathering.
के भी विभिन्न कोर्स संचालित किए जा रहे हैं। कि हम लोग एक मेंटर इंस्टीट्यूट हैं। नर्सिंग क्षेत्र में कार्यरत फैकल्टी और अध्ययन छात्राओं की ज्ञान वृद्धि और उन्हें नवीनतम विकसित नर्सिंग तकनीक की जानकारी प्रदान करने के लिए संस्थान समय समय पर ऐसे कॉन्फ्रेंस आयोजित करता रहता है, जिसमें नर्सिंग की विभिन्न विधाओं के विशेषज्ञ आकर अपने अनुभव एवं अपने ज्ञान को साझा करते हैं। आशा है यह कॉन्फ्रेंस सभी प्रतिभागियों के लिए लाभदायक सिद्ध होगी और वे यहाँ से नए अनुभव एवं तकनीकी जानकारी प्राप्त करके अपने कार्य क्षेत्र में बेहतर करने का प्रयास करेंगे। अंत में आप सबका पुनः आभार व्यक्त करता हूँ कि आप सब ने अपना अमूल्य समय देकर इस आयोजन को सफल के लिए अपना योगदान दिया। जय भारत।
Thank you, sir.
डॉक्टर R.S. दुबे साहब, अध्यक्ष समर्पण इंस्टीट्यूट ऑफ नर्सिंग एंड फार्मास्यूटिकल साइंसेस, डॉक्टर V.P. तिवारी साहब, डायरेक्टर ऑफ द इंस्टीट्यूट, दीप्ति शुक्ला जी, प्रिंसिपल, डॉक्टर राकेश कुमार जी, अनदर स्टालवर्ड इन द फील्ड, और आज के इस 3 दिवसीय नर्सिंग के कंप्लीट विषय को कायाकल्प करने के लिए विचार मंथन हेतु आयोजित कार्यशाला में भाग ले रहे फिजिकली मेरे सामने जो उपस्थित है और डिजिटली जो तमाम सारे लोग जुड़े हुए हैं, देश भर से जुड़े हुए हैं, इस 3 दिन के कॉन्फ्रेंस में भाग लेने के लिए आप सब लोगों का मैं बहुत बहुत अभिनंदन करता हूँ। कल हमारा बहुत महत्वपूर्ण दिन था, श्री कृष्ण जन्माष्टमी। भगवान श्री कृष्ण जो कि भगवान के पूर्ण मानव शरीर के रूप में आए और उन्होंने कितनों का दुख हर लिया, जिनके नाम मात्र से ही तमाम किस्म की चीज़ें, तमाम बाधाएं, व्याधियाँ या और तमाम सारी चीज़ें जो दुख दर्द होता है स्वतः समाप्त हो जाता है। कल ही उनका प्राकट्य दिवस था। मैं भगवान श्री कृष्ण जन्माष्टमी का आप सबको अभिनंदन भी करता हूँ और सबको बधाई भी देता हूँ। डॉक्टर दुबे को मैं बहुत दिनों से जानता हूँ। इन्हें मैंने काम करते हुए देखा रामलो रोहिया में, जिस समर्पण के भाव से काम कर रहे थे, उसी समर्पण का नाम देकर के उन्होंने इंस्टीट्यूट प्रारंभ कर दिया। मैं उसके लिए उन्हें बधाई भी देता हूँ और उनको बहुत बहुत शुभकामनाएं देता हूँ कि जिस उद्देश्य की पूर्ति हेतु आपने शुरुआत किया, एक नर्सिंग इंस्टीट्यूट को अभी आपने बताया कि QCI में 97% प्राप्त करके पूरे प्रदेश में सबसे बेस्ट, और उसके साथ ही साथ एक मेंटर इंस्टीट्यूट हमारा मिशन निरामया के तहत एक मेंटर इंस्टीट्यूट के तौर पे अन्य नर्सिंग फैसिलिटी जो हमारे पूरे प्रदेश में है उनको भी आगे बढ़ाने के लिए जो आपने जिम्मेदारी ली है, उसके लिए मेरी बहुत बहुत शुभकामनाएं। देखिए, नर्सिंग हमारे लिए कितनी महत्वपूर्ण है ये मुझे बताने की आपको आवश्यकता नहीं। नर्सिंग जो शुरू होती है हमारी माँ से, जब बच्चा पैदा होता वहाँ से उसकी नर्सिंग स्टार्ट होती है कि कैसे बच्चे का हर एक दुख दर्द कष्ट जो कुछ भी है सब कुछ माँ अपने ऊपर लेकर के उसका पालन पोषण करती है। वहाँ से हमारे अंदर माँ से वो नर्सिंग की भावना आती है, वो जो कंपैशन आता है, जो एक भावनात्मक संबंध आता है, वो भावनात्मक संबंध स्वतः माँ से हमें मिलता है। और वो जब एक प्रोफेशन का व्यवसाय का रूप ले लेता है तो वो सबके लिए माँ का स्वरूप हो जाता है। चाहे वो बच्चा हो, बड़ा हो, बूढ़ा हो, सबके लिए उसी भाव से वो काम करता है। और माँ का स्वरूप मैं समझता हूँ कि धरती पे सबसे बड़ा जो स्वरूप है, सबसे जो महत्वपूर्ण स्वरूप है, जो जिस किसी रूप में इंसान आ सकता है, उससे बड़ा और कोई स्वरूप नहीं हो सकता। इसलिए नर्सिंग एक बहुत ही एक क्या कहते हैं, बहुत ही महत्वपूर्ण प्रोफेशन है, बहुत ही महत्वपूर्ण व्यवसाय है। लेकिन किन्हीं कारणों से इसका विकास हमारे इस क्षेत्र में जो उत्तर भारत है वहाँ पे उतना नहीं हुआ। जब हम नर्सेस की बात करते थे, मिडवाइफ्स की बात करते थे, तो हमें सीधे दक्षिण भारत के लोग नजर आते थे। किसी भी अस्पताल में, कहीं भी, या यहाँ से हिंदुस्तान से जो विदेशों में भी नर्सिंग के लिए जाते थे, हमें दक्षिण भारत का ही नाम, केरला का नाम आता था कि वहीं के लोगों में नर्स। ऐसा नहीं, मातृत्व भाव तो सब में है, केवल उसे जगाने की बात है, उसे एक टूल देने की बात है, एक मैनेजमेंट टूल देने की बात है, प्रोफेशनल टूल देने की बात है कि कैसे उस भाव के साथ किसी की भी हम सेवा कर सकते हैं। और इसका नतीजा अब धीरे धीरे वो जागृति आनी चालू हो गई। जो हमारे उत्तर प्रदेश सरकार ने मिशन निरामया का शुभारंभ किया, केवल इसी उद्देश्य से किया कि हमारे यहाँ, आपको मालूम है कि हाल के समय में इतनी तेजी से मेडिकल कॉलेज बढ़ते चले जा रहे हैं। आज हमारे 65 जनपदों में मेडिकल कॉलेज या तो चल रहे हैं या चलने वाले। 10 और जनपद के लिए हम लोग प्रयास करें, सारे एवरी 1 डिस्ट्रिक्ट 1 मेडिकल कॉलेज बन रहा है। हर जिले का जिला अस्पताल बहुत बड़ा बन रहा है। आज हमारा जो सीएससी हुआ करता था, सीएससी का रूप व्यापक हो रहा है। आज गांव-गांव में जो हमारा आज आयुष्मान भारत, जो माननीय प्रधानमंत्री जी ने संकल्प लिया कि सबको स्वास्थ्य, सर्व सुलभ स्वास्थ्य, सबको स्वास्थ्य की सुविधा देने के लिए, तो वेलनेस सेंटर हमारे गांव-गांव में, शहर के कोने-कोने में, सब जगह ये इसका शुभारंभ हो रहा है। और ये सब जो हमारे जो स्वास्थ्य की सेवाएं बढ़ रही हैं, वो स्वास्थ्य की सेवाएं केवल मेडिकल प्रोफेशन की बात करें तो केवल डॉक्टर से नहीं, बल्कि डॉक्टर से ज़्यादा महत्व उसका है जो उसका डॉक्टर के दिए हुए विशेषज्ञ ज्ञान का उसका केयर कर सके, तो दवा मिले समय से, उसका जो भी आवश्यक सही उसके पौष्टिक आहार मिले समय से, उसका जो व्यवहार हो, कार्य हो, सब कुछ इस समय से हो। और वो सारी की सारी जिम्मेदारी हमारी नर्सेस के ऊपर होती है। जब हम फ्लोरेंस नाइटिंगेल का नाम लेते हैं तो स्वतः मन में कितना सुंदर सा भाव आ जाता है, कितना बड़ा एक बड़ा सत्ता का भाव आता है। ये नर्सिंग प्रोफेशन का जो है ये महत्व है, जहाँ पे कोई नहीं पहुँच सकता। आप मिलिट्री में भी नर्सिंग सर्विसेज, आज इतनी बड़ी मिलिट्री में नर्सिंग सर्विसेज है, लेकिन उसको फीड करने के लिए नर्सेस की कमी है। जो वर्ल्ड हेल्थ ऑर्गेनाइजेशन है वो देता है 3 नर्सेस पर 1000 पॉपुलेशन। आपको मालूम, हमारे उत्तर प्रदेश में केवल 0.6 नर्सेस पर 1000 पॉपुलेशन हमारे पास है। हमारे अन्य राज्यों में से कहीं ज़्यादा। ऐसा नहीं हम देश में सबसे नीचे तो नहीं है, लेकिन हम नीचे से ही काउंट होते हैं। इसको तेजी से बढ़ाने की जरूरत है। बहुत सारे नर्सिंग स्कूल्स हमारे यहाँ उत्तर प्रदेश में, जब इसकी आवश्यकता देखी कि बहुत सारे तेजी से मेडिकल प्रोफेशन बढ़ रहा है, तेजी से मेडिकल कॉलेजेस, मेडिकल सुपर स्पेशलिटी और मेडिकल फैसिलिटीज हमारी बढ़ती जा रही हैं, बहुत सारे तमाम सारे नर्सिंग स्कूल खुल गए। लेकिन नर्सिंग स्कूलों में उनका अध्ययन, अध्यापन की क्वालिटी के ऊपर कॉम्प्रोमाइज हो रहा है। जो आवश्यकता होनी चाहिए, जब उससे नर्सेज निकले, जिस क्वालिटी के निकले, जो अपेक्षा थी वो नहीं हो रहा था। मिशन निरामया ने एक लक्ष्य लिया, और वो लक्ष्य लिया कि पहला, सबसे पहले तो हमारे नर्सिंग प्रोफेशन में आने वाले जो बच्चे हैं वो अच्छी क्वालिटी के होने, जिन्हें उनका एंट्रेंस एग्जामिनेशन में ही सही बच्चों का सिलेक्शन होना चाहिए। फिर सही किस्म का उनका शिक्षण प्रशिक्षण होना चाहिए, उनके वो सारी सुविधाएं उपलब्ध होनी चाहिए जिसके माध्यम से वो नर्सिंग कर सकते हैं। तो नर्सिंग एक स्किल भी है और साथ साथ आपका मेंटल एंड साइकोलॉजिकल आपकी अपब्रिंगिंग भी, तो उसको कैसे कर सके वो सारी व्यवस्था आपके स्कूल में होनी चाहिए और उनका सही एग्जामिनेशन भी होना चाहिए। नहीं तो पता चला नर्सिंग की डिग्री तो आपको मिल गई, लेकिन जब आपके सामने कोई पेशेंट है आप घबरा करके करें क्या, और वहाँ तो कोई नहीं, वहाँ तो न डॉक्टर है न कोई है, बल्कि आप ही उसके लिए सारे भगवान का स्वरूप अगर कोई है तो वहाँ पे नर्स ही सामने। तो उनके अंदर उस प्रकार का कॉन्फिडेंस लाना, उस प्रकार की स्किल बिल्ड करने के लिए वो सही किस्म का एग्जामिनेशन हो, और वही नहीं बल्कि उनके लिए सही अपॉर्चुनिटीज भी मिले नर्सिंग के लिए, उनको आगे अपॉर्चुनिटीज उन्हें हॉस्पिटल्स में ऐसा ना हो कि मैं उनको अगर सही, क्योंकि अल्टीमेटली वो एक उनका रोजी रोटी का भी जो एक जरिया होता है, तो उन्हें सही उनका वेतन मिले, सही उनका सब सम्मान मिले। ये सारे एस्पेक्ट को हमारे मिशन निरामया में एड्रेस किया गया और इसीलिए एक मेंटर इंस्टीट्यूट का भी कॉन्सेप्ट रखा गया कि ऐसा इंस्टीट्यूट जैसे समर्पण इंस्टीट्यूट है, तो ये इंस्टीट्यूट जिस स्तर पे है क्या वो दूसरे इंस्टीट्यूट को पुल कर सकता है, क्योंकि ये सबका साथ सबका विकास सबका विश्वास, ये उस मंत्र के साथ जो माननीय प्रधानमंत्री जी ने दिया, उस मंत्र के साथ हमारा सबका विकास होगा। और विकास तभी संभव है कि जो कमजोर है उसको, जो सबल है वो निर्बल को ऊपर उठाए करके आगे बढ़े। और इस प्रकार का प्रयास आज उत्तर प्रदेश में बहुत तेजी से हो रहा है, सब क्षेत्र में हो रहा है। जैसा कि भी दुबे जी ने बताया, आप सबसे ऊपर हैं, सबसे अग्रणी है, लेकिन सभी जगह इस प्रकार के हमारा एक टीम वर्क होकर के उत्तर प्रदेश में काम चल रहा और बहुत तेजी से विकास हो रहा है। पहले तो हम केवल मिडवाइफ बना करके प्रसन्न हो जाते थे, आज बीएससी नर्सिंग के कोर्सेज होते हैं और अब मास्टर्स नर्सिंग, ताकि हमको फैकल्टी भी तैयार करना है, आने वाली जनरेशन बनानी है, उसके लिए भी प्रयास हो रहा है और उसके लिए भी तमाम सारी चीज स्ट्रेटेजी हो रही है। और ऐसे हालत में जब ये पूरा का पूरा सिस्टम व्यवस्था हमारा एक आगे बढ़ रहा है, उत्तर प्रदेश में हमारी न केवल हम अपनी नर्सिंग की आवश्यकताओं की पूर्ति करेंगे, बल्कि हम नर्सेज की आपूर्ति बाहर को भी करेंगे। हम अपने देश के अन्य राज्यों में जहाँ पे शॉर्टेज है वहाँ भी हम अपनी नर्सेज को भेजेंगे, उनको एम्प्लॉयमेंट के लिए भेजेंगे। जहाँ विदेशों में आवश्यकताओं की हम वहाँ भी भेजेंगे, क्योंकि नर्सिंग प्रोफेशन तो ये स्थितिजन्य नहीं है, ये भौगोलिक स्थिति के अनुसार नहीं, तो सभी ह्यूमन रिक्वायरमेंट है। आज जब हमारी जो पूरी की पूरी हमारी जो लाइफ साइकिल बढ़ रही है, हम लोग की जो आज जो एवरेज एज हमारी बढ़ रही है, तो जो जेरेंटोलॉजी, जो हमारे वृद्ध लोग हैं उनकी सेवा करने के लिए उसके नर्सिंग आवश्यकता काफ़ी बढ़ती चली जा रही है। आज जब हमारी फैमिलीज में कोई देखने वाला नहीं, केयर करने वाले, उनको कौन केयर करे, कैसे करे, क्योंकि लाइफ तो आपकी 80 साल 90 साल 95 साल हो रही है, कौन उसका केयर करेगा। तो ये नर्सिंग की आवश्यकता तो धीरे धीरे बढ़ती जा रही है, इतना बढ़िया प्रोफेशन चलता चला जा रहा है, उसके लिए क्या करेंगे। तो ऐसे में जब हमारा प्रदेश इस तेजी से बढ़ रहा और बहुत जल्दी एक लक्ष्य लेकर के हम लोग चल रहे कि कैसे हम लोग जो WHO का नाम हम लोग वहाँ तक पहुँच सकते हैं, ऐसे में इस प्रकार का एक कॉन्फ्रेंस जहाँ अंतर्राष्ट्रीय हस्तियाँ यहाँ पे बैठी हुई, मुझे बताया गया कि USA से लेकर के USA से भी है, ऑस्ट्रेलिया से भी है, नीदरलैंड से भी है, सऊदी अरबिया से भी है और तमाम सारे देशों से भी है। और अपने देश के वो नामचीन हस्तियाँ, कहीं के प्रिंसिपल है, कहीं के बहुत बड़े एक्सपर्ट हैं, वो तमाम सारे लोग इस कॉन्फ्रेंस से जुड़े हुए हैं। तो आप जब कॉन्फ्रेंस से जुड़े हैं तो आपको सारे विषयों पे बड़ी गहनता के साथ विचार करने की बात है कि हम क्या करें कि जो हमारे देश की आवश्यकता है, जो हमारे प्रदेश की आवश्यकता है, उस आवश्यकता की कैसे भरपाई करें। एक अच्छा विशेषज्ञ मातृभाव से, जो हमारा सेवा भाव जो है, उस भाव से पूरी तरह से सना हुआ, पूरी तरह से मजा हुआ, कैसे हम ऐसे नर्सेज को हम लोग पैदा करें। उसके लिए हमें नर्सिंग एजुकेशन के बारे में जो हमारा जो कॉन्फ्रेंस हो रही है, उस कॉन्फ्रेंस को हमें हर एस्पेक्ट को, जो नर्सिंग के जितने सारे एस्पेक्ट हैं, सारे के सारे एस्पेक्ट को मैं समझता हूँ कि आपको छूने के अब तक 3 दिन तक लगातार ये हमारे विशेषज्ञ अलग अलग विषयों पे चर्चा करेंगे। आज हमारी नर्सिंग की क्या आवश्यकता है, जो हमारी क्लिनिकल, उसको जो है जो पेशेंट है, उस पेशेंट का क्या बिहेवियर है, कैसे उसको रिस्पॉन्ड कर रहा है। और आज तो हमारे हाथ में टेक्नोलॉजी के टूल्स हैं, हम चीज़ों को, जैसे कुछ चीज़ें आप देखते थे आप भूल जाते थे, जब अगले दिन जब डॉक्टर आएंगे तो तब पता नहीं याद रहेगा कि नहीं याद रहेगा कि फला वक्त इस बच्चे के या इस पेशेंट के ऊपर या ये हमारी जो महिला है जिसे किस काम के लिए उनके ऊपर ये तकलीफ हो रही थी। आपको जानकारी नहीं थी, आप कोई रिकॉर्ड कर रहे थे। कुछ डॉक्टर लोगों का लिखने का भी स्टाइल ऐसा होता है कि कोई बहुत कम लोग पढ़ पाते समझ पाते। तो ऐसे में वो रिकॉर्ड को, आज तो टेक्नोलॉजी आपके पास, छोटा सा अगर आपका जो आईपैड है, आईपैड पे आपने रिकॉर्ड कर लिया और आपको कहने की भी जरूरत नहीं है। आज हमें टेक्नोलॉजी ने एक दूसरे को ऐसे कनेक्ट कर दिया है कि आप यहाँ लिखेंगे, डॉक्टर वहाँ पे पढ़ जाएंगे, समझ लेंगे, उनके पास ही पहुँच गया। और उसकी एनालिसिस भी अगर आप देखेंगे, कोई ट्रेंड निकालना चाहेंगे, वो ऑटोमेटिक सिस्टम ही अपने आप ट्रेंड निकाल देगा। तो कैसे हम लोग क्लिनिकल नर्सिंग के बारे में क्या इंफॉर्मेशन कैप्चर कर सकते हैं, जो इंफॉर्मेशन उस पूरी की पूरी क्लिनिकल टेक्नोलॉजी को, जो आपकी जो व्यवस्था है, जो आपने देख रखा है, क्योंकि उस चीज़ के ऊपर क्या चीज़ कर सकते हैं जिससे आने वाले समय मेडिकल रिसर्च का वो एक टूल बन जाएगा। जैसे नर्सेज जो काम करेंगे उसके आधार पर मे भी नए किस्म की दवाएं बन सकती हैं, नए किस्म के आपके कैसे प्रेस्क्राइब किया जाए, किस तरह से किया जाए, बहुत सारे जो चीज़ें हैं वो आज वो टेक्नोलॉजी के माध्यम से उसको संभव है। आज जो हम स्पेशलाइज केयर कर रहे हैं, चाहे वो बच्चे के बारे में पेडियाट्रिक हो, आज वो देखें कि पेडियाट्रिक का ही कंप्लीट, हमारे यहाँ खुद नोएडा में हमारे पास पेडियाट्रिक का एक कंप्लीट इंस्टीट्यूट है, जेरेंटोलॉजी का एक अलग से इंस्टीट्यूट यहाँ पे आपके जो है KGMU में बना हुआ है। तो आज ये जो स्पेशलाइज केयर करने की जो बात हो रही है, स्पेशलाइज केयर, उसका जो पेडियाट्रिक करे तो बच्चे का जो हार्ट से लेकर के बच्चे के अपने जो अलग अलग अंग है, वो सारी के सारी चीज़ों के ऊपर आज इतने स्पेशलाइजेशन हो रहे हैं। एक बहुत ही PGI में सलोनी हार्ट फाउंडेशन के माध्यम से बन रहा है। तो पेडियाट्रिक के उसके बारे में कितने सारे ऑब्जर्वेशन, क्योंकि ज़्यादातर केयर तो आप ही करते हैं, जो आप उसके साथ 12 घंटे 14 घंटे 16 घंटे आप उनके साथ गुजार रहे हैं, आपको सच्चा था ज्ञान उनके बारे में, तो क्या वहाँ से आपके इस ज्ञान का फायदा हो सकता है? हमारा आज जो जिस प्रकार से टेक्नोलॉजी में परिवर्तन हो रहा है, जैसे जो चीज़ें हो रही है, सिमुलेशन, मुझे बड़ा अच्छा लगा कि आपका प्री वर्कशॉप, आपका एक सिमुलेशन के ऊपर जो है एक वर्कशॉप किया गया। और सिमुलेशन का मतलब होता है कि रियल नहीं, समथिंग विच इज क्लोज टू रियल। आज जो मैनपिन के बारे में मैंने रिक्वेस्ट किया, भारत सरकार के जो संबंधित मंत्रालय, उनसे मैंने रिक्वेस्ट किया कि कैसे हम लोग मैनपिन के कॉस्ट को गिरा सकते हैं, कैसे हम इसको आत्मनिर्भर भारत के तहत इसको कम से कम कॉस्ट में बनाए, जिससे सर्वसुलभ हो जाए, क्योंकि उनका कॉस्ट काफ़ी ज़्यादा है और उससे इन बच्चों को पढ़ाना पड़ता है। बहुत सारे नर्सिंग इंस्टीट्यूट को मे भी वो उतना एफर्ट नहीं कर सकते, और एफर्ट करते तो कॉस्ट किसके ऊपर जाएगा? उन बच्चों के ऊपर जाएगा। तो उसके लिए कैसे हम इसका कॉस्ट को कम कर सकते हैं, आप क्या उसको चर्चा कर सकते हैं? बहुत सारी बातें, बिकॉज आप तो देखते हो, आप दिन रात इनके साथ काम करते हैं। तो कैसे हम लोग इस टेक्नोलॉजी के माध्यम से हम अपने इस चीज़ों को सिमुलेट कर सकते हैं, सिमुलेट करके रियल टाइम एक्सपीरियंस हम करके देख सकते हैं कि जिसके माध्यम से हम उन चीज़ों को और ज़्यादा गहराई में जा करके समझें। क्या करें कि हमारा एजुकेशन सिस्टम ज़्यादा इफेक्टिव हो, क्योंकि ये एजुकेशन, आपका एजुकेशन एक केवल टेक्निकल एजुकेशन नहीं है, ये केवल टेक्नोलॉजी नहीं है कि आपको ये दवा इसमें देनी है, चाहे आपको इस प्रकार से यहाँ पे ये कोई बॉडी फिजिकल आपने कोई प्रक्रिया आपको करनी है जिसके माध्यम से वो उसका ठीक हो जाएगा, नहीं। ह्यूमन बिहेवियर क्या करें कि उसमें हमारा कंपैशन बढ़े, क्या करें कि वो उससे, क्योंकि आपने शायद वो कहानी पढ़ी होगी द डॉक्टर्स वर्ल्ड। डॉक्टर वर्ल्ड एक कहानी, बड़ी अच्छी कहानी थी, जब हम क्लास 9 में पढ़ते थे, हमारे सिलेबस में द डॉक्टर्स वर्ल्ड। डॉक्टर का वर्ड ज़्यादा इंपॉर्टेंट होता है डॉक्टर मेडिसिन से, और उस पेशेंट के लिए तो डॉक्टर से ज़्यादा वो नर्सेज ही उसकी ज़्यादा वो डॉक्टर है, क्योंकि ज़्यादा वक्त तो नर्सेज ही गुजारती है उनके साथ। और आप देखिए कि आप लोगों के अनुभव होंगे, मुझे अपने खुद के अनुभव हैं, जैसे हमारे पिताजी बीमार पड़े, मेरी माँ को बीमारी हुई और मैं हॉस्पिटल में जब समय गुजारना पड़ा, तो कई सारी नर्सेज होती है, वो आपके साथ उनका रिश्ता जो लंबा रिश्ता बन जाता है, क्योंकि उनका इतना अच्छा बिहेवियर होता, लगता है वो तो हमारी अपनी खुद की बहन है। मेरी खुद की अपनी मैंने ताई जी, अपनी चाची जी, अपनी मौसी जी, उस टाइप पे बिहेवियर फील होने लग जाता है। लेकिन कई ऐसे होते हैं जिससे कहते हैं भाई इनसे भगवान बचाओ, इनको तो इनसे दूर रहो। तो कैसे आप उस प्रकार का कंपैशन, कैसे आप उस प्रकार का उसके व्यक्तित्व में वो विकास कर सकते हैं, ये भी अपने आप में एक रिसर्च का विषय है। उस रिसर्च के विषय को कि ये नर्सिंग जो है आपको हर किस्म के लोगों को, कि पेशेंट का कोई न जाति होता, न धर्म होता है, न आय होती है, न कोई, उसको किसी प्रकार से डिवाइड नहीं कर सकते। पेशेंट इज ए पेशेंट एंड पेशेंट नीड्स केयर, पेशेंट नीड्स कंप्लीट केयर, तब जाकर के वो ठीक होगा, क्योंकि उसके लिए तो आप भगवान का स्वरूप है। तो उसके लिए आप क्या रिसर्च कर सकते हैं? आज जो हमारी एक जो खुद की अपनी सनातनी व्यवस्था है, जो हमारे परिवार से, हमारे संस्कार से, हमारे विरासत से मिला हुआ है, आपके पास्ट में बहुत सारे ग्रंथों में बहुत सारी बातें होंगी, क्या उन चीजों को भी आप अंगीकार कर सकते हैं? क्या पहले इस प्रकार की नर्सिंग के बारे में हमें जो व्यवस्था थी उसको ला सकते हैं? क्या वजह है कि आयुर्वेदा सबसे ज्यादा साउथ में पनपा? क्या वजह है कि सबसे ज्यादा हमारा नर्सिंग वहीं पनपा जहाँ पे आयुर्वेदा सबसे ज्यादा पनप रहा था? इन दोनों का क्या संबंध है? क्या आप इसको सोच सकते हैं? ये भी एक, मैं समझता हूँ, रिसर्च का विषय हो सकता है, सोचने का विषय हो सकता है। कैसे सामाजिक अवधारणाएं, कैसे सामाजिक व्यवस्थाएं एक दूसरे को रीइंफोर्स करती है, ये भी विषय हो सकता है। बहुत सारे विषय हैं जो कि मैं समझता हूँ कि नर्सिंग के बारे में, क्योंकि हम इस स्टेज पे हैं जहाँ से हमें आगे बढ़ना है। ये हमारा जो है जो समय है, ये समय देश को आगे बढ़ाने का, देश एक विकसित देश बनने के लिए बहुत तेजी से बढ़ रहा है। ये गोल्डन पीरियड है, इस गोल्डन पीरियड में सब चीज में परिवर्तन हो रहा है, तो इस फील्ड में भी परिवर्तन की आवश्यकता है, और वो परिवर्तन ऐसा हो जो स्थायी परिवर्तन। और ऐसे में जो हमारे तमाम सारे विशेषज्ञ हैं, आपकी जिम्मेदारी बहुत ज्यादा बढ़ जाती है। बट साथ ही साथ मैं कहूँगा जो हमारे बच्चे यहाँ पे, मुझे बताया कि करीब 1200 बच्चे, अभी डॉक्टर दुबे बता रहे थे 1200 बच्चे यहाँ पे, उन बच्चों के क्या एक्सपीरियंस है, उनका इसमें इस प्रकार के जो जब डिस्कशन हो उनमें उनका अधिक से अधिक पार्टिसिपेशन होना चाहिए। जब उनका पार्टिसिपेशन होगा तो उसे एक नए किस्म के, क्योंकि जो बच्चे देखते हैं, बच्चों को देखने का तरीका अलग होता है, प्रोफेसर से उनको देखने का तरीका अलग होता है। जब ये दोनों बातें होंगी तो उसमें भी और कुछ नई नई चीज़ें पैदा होंगी, नई नई चीज़ें निकलेंगी, जो कि इस पूरे जो आज जो ट्रांसफॉर्मेशन हो रहा है हमारे प्रदेश में मिशन निरामया के माध्यम से, उसको और सशक्त करेगा। मैं आप सारे लोगों को जो 3 दिन का कार्य आपकी कार्यशाला बनी हुई है, उस कार्यशाला के लिए आप सबको मैं बहुत बहुत अपने तरफ से शुभकामनाएं देता हूँ। मैं ये भी आप लोगों से निवेदन करूंगा कि जो लोग हमारे उत्तर प्रदेश में पहले बार आए, मैं दुबे जी से भी कहूँगा कि अगर संभव हो तो जरा हमारे लखनऊ के गलियों में उन्हें घुमा दें, लखनऊ के उनको दर्शन करा दें, देखें कैसे लखनऊ सज रहा है, संवर रहा है। एक नया उत्तर प्रदेश, एक विकसित उत्तर प्रदेश के लिए कैसे हमारे प्रदेश की राजधानी, अगर आप कभी पहले आए होंगे, अब आप देखेंगे बिल्कुल बदल गया है और लगातार बदलता चला जा रहा है। हमारे माननीय मुख्यमंत्री जी ने जिस प्रकार से हर क्षेत्र में जो परिवर्तन लाया है, उस परिवर्तन की झलक आपको जरूर दिखाया। लखनऊ अपने खान पान के लिए, लखनऊ अपने किस्म किस्म के व्यंजनों के लिए, लखनऊ अपने शिल्प के लिए, किस्म किस्म के टेक्सटाइल पे आपको जो ऐसे काम जो मिलेंगे, जो कि बहुत बढ़िया काम आपको मिलेगा, और जो चीज़ आप शायद अपने शहर में वापस जाए, देश में या विदेश में, वहाँ पे कई गुना दाम पे मिलेगा आपको, क्योंकि वो यही बन रहा है, यहाँ के हमारे लोग उसको पैदा कर रहे हैं, तो आपको बहुत अच्छा लगेगा। अपना ज्ञान तो यहाँ दे ही दे, साथ में लखनऊ की कुछ मिठास, लखनऊ की कुछ खासियत भी उसको आप अपने साथ ले जाए। मैं डॉक्टर दुबे से कहूँगा जरूर इसके बारे में इसको फैसिलिटेट करिए, जिससे जब वापस जाए तो लखनऊ और उत्तर प्रदेश उनके दिल में हो। हम उत्तर प्रदेश को आगे बढ़ाने के लिए आगे काम कर रहे हैं, तो हमारा उत्तर प्रदेश से हमने ये भी चीज़ लेके आया, उन्हें हमेशा याद होती रहे। मैं इन्हीं बातों के साथ आपके 3 दिन की पूरे कॉन्फ्रेंस के लिए अपने तरफ से बहुत बहुत शुभकामनाएं देता हुआ अपनी वाणी को विराम दूंगा। धन्यवाद। जय हिंद।
Thank you, sir. Now I also request the Director of Dr. Pushpanjali College of Nursing, Agra, Uttar Pradesh, to present a token of love to our Honorable Chief Guest.
अरे था अरे सामने वही मुझे बुलंद पाटे की आवाज़ सुनाई पड़ी मुझे। ठीक है
नहीं स्वस्थ नहीं है सर।
Honored delegates, please be seated. This is also, the inauguration session is also still going on. Due to sir,
Warm and graceful morning to our honorable chief guest just left from here, Shri D.S. Mishra sir, Professor Dr. R.S. Dubey sir, Chairman Samarpan Group, Dr. V.P. Tiwari sir, Director Samarpan Group, Dr. Rakesh Goria sir, Head and Forensic Medicine, Gyan Sagar Medical College, Dr. Ramu sir, former Dean, RUHS, respected guests, invitees, delegates, media and my dear friends. It's my privilege to propose a vote of thanks and acknowledge the contribution of those who worked really hard to make this event possible. On behalf of Samarpan family, I extend my sincere thanks to the alumni for making today's event a great success. I extend a hearty vote of thanks to our chief guest, Sri D.S. Mishra sir, who spared time from his very busy schedule to grace the occasion today. We had an opportunity to hear him, his thoughts, and this will surely going to encourage us in our future endeavor. Whatever sir has spoken about the nursing, it was really commendable. He has a deep, thorough knowledge about the nursing and so many faraway things he is going to do it. I extend my thanks to our chairperson sir, Director sir, for his continuing support to make this event happen. My sincere thanks to Chairman of OET and EBEC for his presence. Recently we have a MOU with EBEC and OET. My sincere and deep appreciation to the Director of Pushpanjali College of Nursing for his association and continuous support for us. My deep sense of appreciation to respected guests on the dais and off the dais for their graceful presence in the event. I would like to express my sincere thanks to the member of Mission Niramaya, DGME, Government of UP, media representative for their excellent coverage to this program. An event like this cannot be happen overnight. The wheels start rolling wheels away. We have been fortunate enough to be backed by a team of very protective and dedicated members. I am short of the words for their motivated and they have taken the burden to take the task beyond their comfort zone. I am grateful to all the audience coming here and for this best wishes for this event. In nutshell, a big thanks to you, each one of you who made the contribution and the making this celebration memorable. We thank you for being with us. Jai Hind.
more than 25 CNEs and 7 conferences. Ma'am is a state representative of Society of Cardiac Nurses. Ma'am has organized COVID-19 training program for nursing faculty, staff nurses and nursing students all over the Uttar Pradesh. Ma'am is a member of COVID Task Force of King George Medical University and also a member of QS World University ranking. So I request ma'am to kindly come over at development and networking. Ma'am has published 40 papers, articles and publication in the Indexto in UAG, Scopus and referred nursing journals, showcasing a dedication in advancing nursing research and knowledge. Ma'am engaged as a guest speaker at 11 scientific healthcare and nursing event, sharing expertise and insight with the peers and aspiring the nurses. Ma'am has successfully organized 14 sharing and collaborations with the nursing community. Ma'am has actively requested ma'am, so please kindly come on a dais and have a respected seat.
Collaboration with Ministry of Health and implemented across the country. Faculty of Nursing, SGT. Madam has received National Florence Nightingale Award by President of India in 2017. Madam awarded appreciation from NSS Life Achievement Award for Excellence in Education, Research, Administration and Clinical. So I would like Madam, so please Madam start the session.
I request our principal ma'am, Dr. Deepti Shukla, kindly come on a dais and felicitate our speaker as well as chairperson with the floral bouquet.
Ma'am, member of governing body of NNF and editorial board of NNF journal at TNAI. At present, Madam is president of Pediatric and Neonatal Nurses Forum India and president NTI Delhi NCR. Madam has been chairman and member of various committee and member of statutory boards, bodies at IGNO, and she is member of TASI, and she has organized national and international training programs and presented large number of sessions as a resource person.
I request ma'am to felicitate. Also, I request to felicitate our chairperson, ma'am, Dr. Jasmine ma'am. Thank you so much, ma'am.
To one and all. At the outset, I must express my gratitude to the organizers, specifically the principal of the Samarpan Group of Institution College of Nursing, for giving me this opportunity. Having said that, I should say the respected chief guest, I think Shri Mishra ji in the absentia, the director of the institution, chairperson of the institution, principals of the colleges, vice principals, dear faculty members and all colleagues of the nursing profession, including the students and all the faculty. It gives me immense pleasure to be present here to express my some thoughts in relation to the governance and the leadership in higher education institutions. I was thinking that is in the perspective of National Education Policy 2020. I was thinking that the theme of this conference is evidence-based nursing, or the transformation of research in nursing leading to the clinical innovations. I think this is the need of the hour. The clinical innovations are the need of the hour, and all the nursing professionals, whether that are at the basic level, at the mid level and at the higher level, have to put all their efforts to strengthen the clinical training, the clinical practice, and also that will subsequently lead to the increment in knowledge, skills, attitudes and all which is required of higher education. All of you must be aware about the National Education Policy 2020. We had the National Education Policies in 1968 and also the 1984. There were different perspectives and focus mainly on the access and equity. But the National Education Policy 2020 has revamped the educational system to a very major thrust. And I was thinking that this clause 19.1 to 19.5 of National Education Policy document, this has a very strong connotation with the theme which you have kept for this conference, because unless and until the leadership and governance is the order of the day, we cannot achieve anything. The National Education Policy 2020 does not only talk about the general higher education institutions, but it also talks about the professional education. The overall focus is revamping in terms of the duration, the structure, the design, the accountability, the transparency, and the independence, that is the autonomy, and also the vocational education, and also the experiential learning, the students' participation, the faculty development, the research, the wider use of technology in education. These are all, and also the outcome-based, the outcome-based learner, the outcome-based education, and the graduates or the postgraduates with having the different attributes which are acquired throughout the training process or teaching learning activities. So this, having said this, then if we go and discuss about what, and this has a lot of impact on nursing education also. The nursing education in terms which has been, the health education which has been clearly mentioned in the clause 20 of the educational policy document, says that the professional education is the integral part of higher education in general, the professional education. And the professional education has to be reinvented in structure, in designs, and in also the duration, so that they are adapted to the role which the learner is performing in the community. And the focus of leadership, therefore, is then on the communication, it is on critical thinking, and it is also on the research, and it is also on the technology, which helps us to attain the objectives of education, the overall education. The focus is also on integration of education. The focus, what do you mean by integration of education? The focus on integration of education, if we talk about the health education, is that the Ayush should also be integrated into the allopathic education, and the allopathic should also be included into the Ayush, that is Ayurveda, Unani, Yoga, and all other the streams of indigenous education, which was the basic hallmark of the Indian system of health education. And also the multidisciplinary education, the holistic education. But if I talk about the nursing, in nursing, when we used to discuss about the education policy in many forums, we say that the curricula of nursing, we have been fortunate enough that the curricula of nursing had been developed and put into the India into by the foreign missionaries, where they had taken care of interdisciplinary education and the holistic education, which the National Education Policy talks about now. But we as nursing professionals, you all are here as the nursing professionals, you know that our curriculum is all multidisciplinary, and it is also focusing on community. It is also focusing, the National Education Policy focuses on employability, vocational education, and all those things are inbuilt in nursing curricula. So we are fortunate enough to have the very strong curriculum which is comparable to the international standards, because one of the hallmarks of this National Education Policy is also the internationalization of education. The only thing is that to keep a very robust system in place, by what? By effective governance and the management and the leadership, then we can achieve the goal of that curriculum, which is of international standard. So if we talk about what What education is for? The education at all levels, all of us know, is a key driver in economic and social development. Therefore, it is mandatory for all the universities to reorient the focus on needs of society and economy, because needs of society and economy is the ultimate goal which the education should fulfill at all levels, whether higher education in general or professional education in particular. So with the invent of new educational technology, or with the advent of new ways of teaching and learning, autonomy in governance and management of the educational institutions has become the prerogative of higher education institutions itself. And you know, the autonomy is a hallmark of national education policy, and the transformation at the global landscape, both in terms of social and political, it has itself led to the institutions that how should they change the operations and how do they deliver. Then the paradigm shift in education, as I was talking about, there is revolution of information technology, there is globalization, internationalization of education, and it has led to what? It has led to the cross-border exchanges. So there are many, you are seeing at the government level also, today, nowadays G20 meet is going on, and how many countries are coming together to exchange their knowledge in all fields of life, in all fields of governance and management. So this is how the leadership, the crossover exchanges, and also this has led to the student and faculty mobility. So leadership and governance provide a development plan developed collaboratively by the stakeholders. It has to be developed by the stakeholders itself, who are, the stakeholders can be many, which we can see in next slides. And then all this whole thing will depend upon the visionary leadership. Let's have just a very quick look on what are the different types of educational institutions we have. We have central university, we have universities, we have colleges, we have stand-alone institutions, we have central universities, central open universities, state open universities, deemed to be universities, and private universities. At college level, we have government colleges, aided colleges, private aided colleges, private unaided colleges, and then in stand-alone institutions we have technical IITs, technical colleges, teacher education institutes, paramedical, hotel management, and so on. So this is, we cannot go into this detail how they are built. But now the issue comes that what are the issues and challenges in the higher education, and these have been across all the national education policies. The access and equity, and you know, we have seen that since 2014 we have been able to increase the number of institutions at all levels. The universities, the medical institutions, the nursing institutions are rise, the AIMS institutions, all of them are in rise. Because unless and until we have access and equity, irrespective of caste, creed and color, we cannot have a robust system of education provision. Then relevance, the 2020 education policy focuses on the employability, and the value-based education is very important, because we talk a lot about the human values, but you have seen the system, what has happened, how many crimes are occurring, but so human values is a focus, where that is becoming the part of the educational system. Then quality, because we are opening the players to foreign students also, so we have to have the quality of education, that is a challenge. Then we have governance is very important, though we are talking about the governance, but the professional management of the higher education institutions is very important with the proper people. The important thing is that financing is very important. You know, so many national education policies had emphasized for having at least 6% GDP budget for the education, but till today I think it has not, it has been across all the years 4 point something, and we have to reach up to that level which has been emphasized, so that once the financing is there, the quality can come. We have been talking about the governance. If we say in simple words, you know, these are the things, the governance. Governance is always a positive thing. You know, when we talk about the governance, good governance or bad governance. So governance will be what are the policies, the procedures which we are following in operating, in day-to-day activities of all the operations. just controlling and directing, or policies and procedures and practices which we follow into day-to-day administration. That is a governance. But if we talk about the Latin and Greek word, it says that it means steering. So that is again controlling and directing. But the important thing is as we say, structures and processes of decision making to ensure improved performance. So it is a positive direction and accountability of the organization. The performance and accountability are the two important things, because you have to be accountable and you have to be responsible, and unless and until you have the autonomy, you will not have accountability and you will not have the high performance. The e-governance, in this present system of government, lot of things are going through e-governance. When you use the technology for various operations, whether with the students, whether with the governments, whether with the departments, internal, intra and external, all the departments, through the technology, that is e-governance. So governance in higher education can be managed at national level, state level, and also at the institutional level. We have been talking about the policy perspective of the governance, and we have said that the policy 1968 of National Education Policy recognized the reconstruction of education as a challenging task due to complexity. That means all the policies have said that the education was not having a healthy going on. In 1986, recommended establishment of Indian Education Services, and after that there was a modification in 1992, where the elementary education was the fundamental right, all the children should be educated, that was included in this. Then if we talk about, as I was talking about the 2020 policy, it envisioned to turn around the dismal situation through self-governance. This is very, very important. Autonomy, that means self-governance of the educational institutions. The educational institutions were striving for so much of autonomy, but still there are the government, there were and there are now also the government interferences, though we talk about the self-governance, and by establishing of board of governors to exercise all functions of the governance without any interference. But that is long way to come. Each institution is expected to transform itself into self-governing institution through a system of grading, accreditation and graded autonomy. Board of governors have the full powers. This is expected to institutionalize self-governance across institutions of higher learning. So you all know that nowadays every institution is going for NAC accreditation, every institution, whether that is a general higher education institution or that is a private educational institution, because this grading of the institutions by the NAC and other accrediting bodies will help them to have the self-governance. When the state is assured that these have all parameters with which they can become the self-governing institutions. Why should we have the effective governance? We should have effective governance for accountability and transparency. The mode of transparency needs to be in all the institutions, whether they are private institution, private enterprises, because education should not be considered as a business. It has to be an enterprise, but not as a business. So accountability and transparency has to be there. There have to be some system of policies and policy provisions, and the systems inbuilt in itself, not only the policy provisions but also the system through which anybody, if a person goes away, or then when the system is created, then there won't be any problem in managing or governing any institution. It enables efficient and effective working of the institution, creation of culture of excellence and innovation, governance such as responsiveness to change and forward-looking attitude helps in matching need of future with the goal of the institution. So unless and until you have good leadership, you have good governance, in operation, the institutional vision, because the governance is reflected, the good governance and leadership is a reflection of the mission and vision of any institution. So I will not go into the details of what education policy says, creation of the board of governors, and then all the legal proceedings will supersede whatever were existing, then they will have all powers. I will not go into those details. But this also, I will also say who are the stakeholders of the governance: the political leaders, the regulatory bodies, and the senior administrators. These are the main important stakeholders of the this governance at the various levels of administration. What was the traditional model of? We had a collegiate model, we had a state level model, led model, we had a state sponsored model, we had a state supported model, and we had also the evolution in institutional governance model. Governance model in India now is, we all know that you have a statutory body. The education is joint responsibility of the center, state government and the institution. And then when the constitutional amendment of 1976 was there was a centralized model of regulation, which mainly makes the education as the centrally governed model, because all this regulation, all the statutory body were at the central level. So like if we talk about the regulatory body, UGC became the central regulatory body of all higher education institutions, like Indian Nursing Council also became, there are so many other, pharmacy council, now all the commissions have come, even also the National Nursing and Midwifery Commission has come, Paramedical Commission has come, Medical Commission, all commissions have come. The UGC is also going to be replaced as per the National Education Policy, the Higher Education Commission, where all technical education and general education will come under their purview. And what was the responsibility of a, so this was the model of governance is divided at three, that is the state level model, the central and the institutional. And central level we said the mainly to the regulatory bodies. And what are the regulatory bodies? All of you are the principals here, you know very well. Just to say that establish coordination between ministry and the institution, granting of permission to open and operate the institution, decide on the intake of students, decide on the introduction of courses, ensure equity and social justice and all. These are the regulatory bodies. I am not going into the details. And then we said state level governance. We said that the governance at the institutional level and central level. You know, at the institutional level you have all affiliated colleges. In central universities also there are affiliated colleges. But some of the central universities like Banaras Hindu University and Delhi University have affiliated colleges. So that governance percolates through from the central university to these colleges also. And at the state level you have the state quality assurance cell, and then you have also the internal quality assurance cell, which is inbuilt in the NAC manual. So if we talk about the university level, you all know that Vice Chancellor, Senate, Executive Council, Academic Council, somewhere there is Board of Management and all, and sometimes there is Governance Council. The names are different. The colleges, the principal and the faculty and staff, maybe whether it is in nursing colleges and also the general colleges, the governors at that level is this. This also I am not going to, I would just say the benchmarks of effective governance. The board members will have the clear mission, vision and core values of the institution, competent and dedicated board members and workforce, participatory decision making. These are all what you should, as a principles of the colleges of nursing, you should focus on. Participative decision making, transparency and accountability, continuous monitoring and evaluation. Quality is the key priority, and coaching and guiding and training. But if I compare and correlate the theme with the National Education 2020 policy, the focus is on clinical governance, as the topic, your topic says, leading to research, leading transformation in nursing research, leading to the clinical innovations. So you need to have the clinical governance and leadership. And the second level should be decentralization and participatory management. So what are the mechanisms of, future of nursing profession should focus on the clinical governance and leadership, that is person-centered care. And it is essential to the future success of the nursing profession that informal negative leaders of are to be discouraged, and positive leaders possessing evidence-based qualities of leadership are identified and nurtured to lead the profession. So this, having said that, we should focus on quality improvement. So what basically the clinical governance should look for? It's not that ABC has been appointed as a principal and then she will or he will make the wonders. No. You have to create and build a system in which all those people, whether they are staff, whether they are patients, if they pass through that particular system, they should be taken proper care of at all levels. That means quality patient care, the information technology, the communication, the empathy, everything. And similar, not only the patients, but the people who work in the system, they should be facilitated and provided the environment to work. And also, each person who is working in the clinical system should have the capability of performing at the highest level. They should do their best. We cannot say that they should be excellent. They should be able to do their best. But when they are ready to do their best, the government, the institutions, the management, the governing bodies, they should provide them the environment where they can do the best. So all the three things are very, very important from this point of view. So what are the mechanisms? These are the mechanisms with which you can have a very good governance. What are these mechanisms? These are evidence-based practice. So evidence-based practice, as is your theme. You should identify the issues and identify the areas which have the evidences and then base your decision. We should not follow what our old teachers have said. Maybe they didn't have that scientific mind in correlating the things. But young generation has all information explosion. You should not say Piticol has said this, so I am doing this. You should never do that. You should, because you are just a click of this thing, you get whole world's picture. So there is a vast difference between Piticol or anybody else like of my age group than you as youngsters. You have lot of exposure to the information technology and information revolution, and so you can refute and you can also argue that this is not correct, this is correct. So that is where evidence comes. So based on that, when you see the evidences, then you make any decisions whether you are going to the patient care. Research R&D, research and development, because base for evidence-based research or base for research, evidence-based practice is research and development. When you do the research, and then only you will come to the conclusions of evidences. Then clinical audit, nowadays the focus is on not only on the clinical audit but also on the academic audit. The clinical audit will say what are the, it's not that I will just go and review what is existing there, but I have to make sure that whatever parameters are required to function for a particular professional in an effective manner are existing there or not. I cannot appoint a person without anything and then expect so many things from that. So the audit will say that whether those infrastructure facilities, those parameters, those availabilities are there where the person can function, and then he can assess and review, and then also say that is academic audit, and whatever the parameters have been planned and developed, whether they are doing, whether they are following that or not, then it is only then possibility. Confidentiality, it's very important. The clinical standards, it's very, very important. Our students, when they go to the hospitals, they do not know that what a first year student does not know what he has to do, and he cannot differentiate between the second year student. So it's very, very important to provide, to develop at the teacher level, at the faculty level, all the standard operating procedures, and they should be in place, and that the criteria which are standard operating based standard, which are the standards, the acceptable level of performance. That should be well written, and that the copy of that should be with the students, and so that they will not be lost when they go to the hospital, even though they are being given the trainings, they are retrained, they are giving orientation programs, induction programs, that will not be having any use unless and until they are prepared with these standard operating procedures, and then it is checked whether they are following those procedures or not. Then manpower planning is very, very important, because you open the colleges, you open many, but I have seen that in many private institutions, the faculty is almost adequate. But in government institutions, in most of the institutions, there is a crime still existing in the faculties. And then the recruitment policies by the private players should also be formulated in a, they should not just take the faculty for the sake of taking the faculty. You should take the faculty. I have seen that UP government has been taken this Niramaya mission. It is focusing on the development of the nursing service. I am very happy to see, when I was reading about the Niramaya mission of Uttar Pradesh, I was happy that this government has taken the initiative to develop the nurses, and they are accrediting the institutions. They are also making sure that whatever malpractices are there, they do not happen. But it's not only the government which can be successful in combating whatever malpractices are there. This is the institutional management, and also the professionals have to come forward to do that. So manpower planning has not only to recruit the good people who can provide services up to the desired standards of an institution or of objective. So they also need to retain the staff. Then there should be a well-managed system of complaints. You know that somebody comes and complains, or patient complaints, patient attendant complaints, or faculty complaints, staff complaints, student complaints. We should not have a deaf ear to anything. At all levels, there should be a grievance mechanism. There should be a mechanism where all the redressal of all the grievances from all the should be there, so that will help you to do that. Then the monitoring and evaluation is very important. The continuous review is very, very important. Unless and until you take the continuous review of the activities, you will not be able to see what success you have made in your mission. That is very important. And evaluation will not only help you to evaluate that whether the objective have been fulfilled, but it will also help. It is also a learning practice. The evaluation is also a learning practice. It will help you to give the recommendation how to improve further. Then there are certain national confidential inquiries which you should keep. What are the stillbirths, what are the deaths, infant deaths, stillbirth deaths, and all so on and so forth. You should also risk management is very, very important. The patient safety measures are very, very important. There are some natural calamities which can happen in the hospitals that you have to take care, and you have to see what are the injuries, the traumas, the injuries, and all other safety concerns which are occurring in the hospitals. You should be able to identify those, and then you should have the management practices in place so that you can, that anybody, when the fire safety, all those things are there which can be done. Then we talk about whistleblowing also, WB, because unless and until we say that peer reviews are very, very important. When we peer review, when we see a person is doing what one other person is doing, when we do peer review, that's very important area in this. Then CPD, continuous professional development, is one of the important areas which has been also the part of the national education policy. So these are the things which I have already discussed. These I have discussed. How will this success depend? For clinical leadership and governance to be successful, you should have clear lines of responsibility and accountability that you have done. You have organized a conference and you have given the job responsibilities to everybody. A program of quality improvement activities, clear policies aimed at managing risk, procedures to identify and remedy. So effective governance in nursing education institutions, you all know that there are committees, there are coordinators, there are subject specialists, There is principal, vice principal, so on and so forth. Coordinators have responsibility, HODs have responsibility, that I think I don't need to discuss in detail. The College Development Council has to be there, internal policy, quality assurance cells have to be there everywhere, which you all must be doing. And HOD level coordinators, coordinator committee level, this all every institution is practicing, but students have to be. The one important thing which I just want to emphasize is the student. You have to engage the learner. The policy focuses on engaging the learner. Unless and until you engage the learner in the activities, and there is lot of student participation, it's not only that is why we are talking about the experiential learning, we are talking about project-based learning, we are talking about competency-based learning. These have to be taken in the real spirit. Not only we should talk about that we are doing these type of pedagogies, but we must take all these into true spirit, so that the product, so that the outcome product, the graduate attitude, attributes are really what is in your mission and vision of the institution, or mission and vision for training a learner for a degree or a diploma or a postgraduate level. So students' participation in all the activities, because experiential learning will, crossover learning, project-based learning, all those learning, those will expose the learner to the actual system, not the rote learning and the conceptual learning. So all the conceptual learning has to be based on the experiential learning. The participatory management of the faculty and staff is very, very important. Though in practice it is very difficult, but then you have to educate the people what is participatory management, so that unless and until you come to the same platform, you will not be able to govern the institution and you will not be able to improve the clinical performance. Thank you so much for...
Madam, to conclude the session, please.
Professor Dr. P.T. Kaul ma'am has explained very well about national. We are talking much about national education policy. It's a revitalizing session she took today regarding how effectively governance and leadership will be inculcated in our higher education institutions. She was emphasized her topic with the help of critical thinking, integrated, holistic, interdisciplinary curricula will help you to go for a complete evidence-based and quality-based nursing education can be developed. It was very appreciative that our Indian Nursing Council was implemented such a nursing curricula for us. Our nursing curricula of BSc Nursing was already an international standardized protocol we are already implemented all over India. So it's a great enthusiasm. We are also working hard to achieve the goal, and our nurses should be a globalized nurse everywhere. Ma'am already explained various types of educational institutions and what are the common issues in higher educations, and she clearly explained what is the meaning and definitions of governance and how the structure and process of decision making, how we have to ensure the quality and accountability in all the nursing aspect. And she already explained briefly about policies and perspectives of different various institutions, how we have taken care of the nursing education policy from 1968, and after that it is revised in 1984. Finally we got a complete quality based national education system which is currently existing from in the year of since 2020. And along with that she add on the importance of accreditations. Especially this is the one important all the various accreditation example, that is NAC, even NARF, lot of JACO, SACO, so many accreditation policies nowadays existing. All the nursing institutions, universities, central, private, deemed universities are striving to get all these type of accreditation. This is the one platform to boost up the self-governance in everywhere. So this all good governance and leadership is the reflection of the complete vision and mission of the institution, as ma'am has said. And also she emphasized about the importance of stakeholders, how we have to inculcate our different various type of governance with the help of various aspect of models, and certain centralized models we are already following, and these all going to be right and left hand for emphasizing the nursing thrust. We are a part of nursing field. We should be very clear about how effectively this nursing education policy will be emphasizing our nursing curricula. This is ultimately goes for our major areas. She already very well explained about the clinical governance and what is the importance of auditing. That is, we have academic audit and as well as clinical audits. She explained how the leadership should be, what are the major qualities of a leader, especially in the clinical side, and she has emphasized very important thrust area, that is about the participative management. So participative management goes well with the decentralization. So all these decentralized participative management will give you an effective recruitment. It will goes for the quality healthcare, and that quality should be a continuation of quality healthcare. That is the important part. She explained about the higher quality of a nursing education system, and this will be boosted up with the help of two important aspects. She already explained, that is about the peer review. This is also very important aspect when you are going to talk about the quality. So along with that peer review, evidence-based practice, you can assure the patient safety. Along with the patient safety, you can assure a continuous quality healthcare, and you can also be a commitment to the society as we are providing 100% quality care. Along with that, she emphasized and she explained and narrated very effectively that you should have a culture of participative management with a outcome management. So with the help of all these, conceptual learning should be like an experiential learning. All the various learning also will come under in our nursing curricula. Our students are our basically many of the teachers and the students and clinical instructors, bedsiders, so many are sitting here. We should think about that. Being a teacher, your students are the customer. How wholeheartedly you are giving output to the students. Definitely these students will be the outer generation. These generation will come up with the booming of quality care everywhere in the nursing era. So once again, thank you Dr. P.T. Kaul ma'am for sharing such a wonderful session. Thank you so much.
Representing a memento, I also request the next scientific session will be covered by Dr. Ramu K. So he's a Dean, Care College of Nursing, Bangalore, Karnataka. So before we speak about the speaker, I would like to introduce our chairperson of the session. The first chairperson of the session, Dr. Santosh Esu, sir. request sir, please come on and dais. MSc in Pediatric Nursing from the Bhagirathi College of Nursing, Tamkar, Karnataka, affiliated with the Rajiv Gandhi University of Health Science, Bangalore. Sir is an undergraduate degree in a BSc Nursing from the Rajiv Gandhi University of Health Science, Bangalore. With his extensive education and expertise, Sir has made a significant contribution to the field of nursing and CPS PALS course, that is Pediatric Advanced Life Support, and served as an external practical examiner for the A&M and JNM courses from the UP State Medical Faculty. Sir has also worked as an inspector for evaluating nursing colleges in UP under the UP State Medical Faculty, highlighting his role in improving the quality of nursing education in the state. Sir has served as a board member at the UP State Medical Faculty, Lucknow, and guided and headed the Pediatric Nursing Department from 2015 to 2020 in SCPM College of Nursing, Gonda. Sir is a reviewer board or editorial board member of the JPNS IP Initiative for Publications and editorial team member in the American Journal of Nursing and Health Sciences, and a board of executive editor of the Academic Institute of Advanced Research and Journal. His vast experience and expertise in the nursing field make him a valuable addition to any healthcare organization. So big round of applause for Sir Dr. Santosh Kesari. And also PhD Nursing Scholar from the Amity College of Nursing, Amity University, Gurgaon. Sir earned Master of Nursing degree in Community Health Nursing from the Srimati Narayani D.R. Kerugowda College of Nursing, Hassan, Karnataka, India, in 2010 and in 2006. Sir completed his Bachelor in Nursing from the Bapuji College of Nursing, Karnataka, India, received a gold medal for first rank in MSc Nursing from the NDRK College of Nursing, Hassan. Sir is having 14-year plus teaching experience in nursing field. He published 26 research papers in International Journal and 4 papers in National Journal of the Good Impact Factor. He wrote 2 books and owned 4 patents, 1 design and 1 copyright in his name. Sir worked as a NAC coordinator for the period of 2 years in Amity University, Gurugram, and bears sound knowledge in all criteria of NAC. Sir reviewed many nursing books and working in editorial team of 5 major nursing journals. Sir is associated with 8 nursing associations in India and actively participating in uplifting the quality of nursing profession. Sir received Bharat Jyoti Shri Guru Rashtra Samman Award from the MVLA Trust, India. Sir received Best Research Paper Presentation Award for My Research and I Donation during the National Conference on Transition Leadership, a Leading Change at Shraddha University, Greater Noida, UP. Received a Merit Award for the MSc Nursing Distinction from the Avopa, Karnataka. He organized various national and state level conferences, workshop, webinar and FTP, and also presented research papers. So a big round of applause for Sir Professor Navina J. Sir. Now I request our first chairperson, Dr. Santosh Kesari sir, kindly introduce our speaker, Dr. Ramu K.
Thank you, ma'am. I would like Karnataka, and he is having over more than 32 years of experience in nursing education, and he has instrumental in reshaping the nursing landscape at RGHS, and he has trained more than 1 lakh nurses during the COVID crisis, and he is a recognized scholar who has published more than 30 publications, and he has guided and as a mentor for more than 100 plus PG students and delivered impactful presentation in global hubs like Tokyo and Dubai. And he has also been honored with prestigious awards including the Best Principal, Best Teacher and a Lifetime Achievement. And for his innovation, he has been known and for fostering the positive changes in nursing practices, an inspiring figure extending influences across the national and international nursing community. And Dr. Ramu K. Sir is a visionary educator and leader dedicated to advancing the nursing impact. I would like to welcome Ramu Sir for this conference, and we will hear from him.
I request our Principal Ma'am, Dr. Deepti Shukla, and kindly come over the dais and welcome our speaker for the session by presenting a flower. I also
relate. And the attention span of people is coming down, right? Definitely, no doubt in that. Like 5 days match, cricket match is reduced to 50 hours match, 50 hours match again reduced to 20 hours match, and shortly the Government of India, International Council, Cricket Association is thinking seriously that they implement cricket in Olympics. Maybe it will be 10 hours match, so that you can attend that very enthusiastically. Anyhow, and I don't want to take much time. Let me start this presentation. Before starting with this presentation, I have to remember my wife. She has passed away 4 years back with terminal illness, cancer. I got a lot of experience about that, how the problems will be, right? Before my presentation, the terminal illness, and it is very serious condition, disease condition, very well, and very, very important here. Once it is also known as once the terminal illness, that will see later, terminal illness definitely it may lead to death. But here, very, very important, we should remember this, right? If anybody, any patient affected with such type of terminal illness diseases like cancer, heart diseases, dementia, right, and many of them, that will see later. They have decided, yes, my life has gone. I'm not going to survive for long. God may take, right? And though many treatments are there, many treatments in India, technology has improved a lot. More technology is there. Even our Chief Secretary was talking about that. Technology has improved a lot, but because of terminal illness is really, really affecting. So what is this? Why it is like that? You see that? So I am going to talk about domains of palliative care, right? What it is exactly. The palliative care. If patient and the family, if you come across, they hear the word term palliative care, they think that they'll have a lot of fear and they think that life has gone and doctor has given up hopes, I'm going to die shortly, of no use. This type of fear and attitude, it leads to lack of understanding. There's lack of understanding about this. Many actually, in India, you can say that in India, actually 1.89 million people are suffering with cancer, especially 1 million people are suffering with moderate to severe pain, any type of pain, that will say that. So, once this type of patients are admitted to the hospital, the cost is very important, the quality of life is very, very important, right? So, we'll see what is this palliative care. Yes. So, according to WHO, an approach that improves quality of life of the patients and their families who face problems associated with life-threatening illness. Life-threatening illness, very important. And another definition, it is any form of care or treatment that focuses on reducing the severity of disease symptoms rather than trying to delay or reverse the progression of the disease itself and provide a cure. And see the history of palliative care, how it was originated in India, around India. Because palliative care actually originated as end of life care in the year 1960. And it is a term derived from the Latin, that's okay, top, yes. And if you see this father of palliative care, Cecily Saunders, she is actually founder of palliative care. The field of palliative care has grown out of hospice movement. Actually, it is everybody knows, the public knows, more familiar with the word hospice care, right? And of course, this is it was introduced in the year 1967. Both this hospice and palliative care are considered same until 1980s, right? when hospital-based palliative programs were developed, so it is palliative care concept has improved. Now, you can see this the background history of this concept of palliative care. There are now over 1,400 palliative care programs in USA. Over 80% of hospitals with more than 300 beds with the palliative care. Okay, now we'll see the history of palliative care in India. Before going to that, very interesting. I can say that, of course, this is a palliative care program is there in India since 20 years. It is there, is going on for 20 years. Lot of obstacles. It's not coming up much. Why? The reason is these are the one. One is I told it is mentioned here clearly: population obesity, poverty, geographical diversity, district policies, and very important, limited national palliative care policies. We don't have palliative policies, right? And palliative program was actually born in Mumbai in the year 1986. The slide what you are seeing now is Dr. Rajgopal. He is the founder of palliative care in India. He is the one started palliative care the concept of palliative program because of him, because he has introduced this palliative program in India, especially in Kerala, and many states are following these programs, right? He has formed a trust. It's called in the year 2003, right? And of course, this is background. He worked in the pain care clinics. Very important. I told just now, the year 2003, he has founded a charitable trust, Pallium India in Kerala. Yes, very interesting. I'm proud to say that being a doctor, he is respecting nurses, giving training to the nurses about the palliative care. He himself is going with the team, going to community and educating the public, especially the terminal ill patients, and improving the quality of life. And if you see globally, the palliative care, history of this palliative care worldwide, right? According to WHO, it is estimated that 14% people need palliative care. I mean, 56.88 million people are in need of palliative care globally, right? And UK is the one who is providing best palliative care in the world. Afterwards, USA and the next other countries will come. In England, 378,000 yearly receive the palliative program. And if you see, I told at the beginning, the cost of palliative program is very high. Especially in India, it is coming 40,000 per day, whereas in UK, 1,000 to 2,000 pounds per week. And whereas in USA, right, of course, it is a shortage since 10 years, and it will be very costly also. It is $95 for home care per day, whereas in a hospital, the palliative care expense is $32,643, right? And another very important, along with these two countries, along with this USA and UK, that many nurses from India, they are now working in Germany and Gulf countries. If you go to Gulf countries, palliative program is not that. So England is the one is giving the best palliative care globally. After that, USA and other countries will come. Then India also is there. And the Gulf countries, the nurses were more from Indian nurses who are working in Gulf countries and Germany. In Gulf countries, right, very limited palliative care programs, right? And main in Gulf countries, they're concentrating only the physical aspects rather than psychological and mental issues, right? Whereas Germany also, of course, Germany, the palliative program services there since 50 years, but there is not that much developments, right? And according to Worldwide Hospice Palliative Care Alliance, 18 million people die unnecessary with the pain, right? 18 million globally.
right? Yes, in India, if you see in India, the palliative program, right, it is estimated that nearly 5.4 million people need palliative care program, and only 1% is accessible this palliative program, right? The concept of this palliative program was introduced in the mid-1980s, and Medical Council of India has launched the MD Palliative Medicine palliative program in 2012, and it is there in Bangalore in Karnataka also, but there is no that much admissions for that program too also. The reasons are many, right? And two major developments you can see in the 1990s. One is formation of Pain and Palliative Care Society in Calicut, and another is Indian Association of Palliative Council. These both associations, right, they are voluntary organizations. All are voluntary, all palliative programs in India, all are voluntary organizations, and there is no fund also, right? And very interesting, I can say that, very proud to say that the palliative and this Pain and Palliative Care Society was first introduced by our fraternity, by British nurse by name Burns, and also along with the two doctors and the laymen, and along with this associations, organizations, many are there in palliative programs in India, like camp support in Delhi. This is the one, they're doing a lot of research on the palliative care program, and also Lakshmi Palliative Care. These are all palliative care programs, and Chandigarh Palliative, and here very important, I can say in 2006, Government of India formed a committee that is called National Policy for Palliative, formed a committee for the National Policy for Palliative Care, and that's not that much successful, right? You know, the Medical Council of India and Indian Nursing Council both also unsuccessful in implementing palliative care in undergraduate curriculum, right? If you see our curriculum, and many are not, even MD programs also, there's not the curriculum, even the doctors are not ready to take. The reasons are many, we'll see that later. In 2007, IFPC approached the Supreme Court, right, for the following points are discussed there, and still it is going on. That is, the main aim of that is central and state government should develop palliative care policies, and NDPS Act, that is narcotic drugs, drugs and the psychotic substances drugs Act of India must be simplified. That we see next slide. Yes, this palliative care program is a part of undergraduate, and also another point they have discussed in the Supreme Court. This should be implemented. This palliative program should be implemented in the curriculum of this medical, both and medical and nursing, but still it's not finalized. In 2012, Ministry of Health declared national policy of the palliative program, but proposed budget is very less, just only 2%. Yeah, these are some of the models of the palliative program. Inpatient, outpatient clinic, home care services also available. I told already, the Kerala is the one. These palliative services are widespread, and it is having more than 60 units covering the population of greater than 12 million people. And this is, and other states also are going through this, copying from that concept. Of course, these are all other organizations that are in the world. Yes, this is the Indian Association of Palliative Care. I am very happy to proud to say that this Indian Association of Palliative Care, right, is motivating, and this is giving the main objective of this Indian Association of Palliative Care is motivating the nurses, and also giving training to the doctors and nurses about palliative care program, and for the training purpose, for the research purpose, they are funding this doctors and nurses also, and approaching in the community areas also, right? This I told, this association, IAP's association, it is a public, this is also very important, public trust and society. It is founded in 1994 in Gujarat, right? And it is supported by Government of India and WHO, but fund also of no use. So it's facing a lot of problems financially also. Right. See, what are the goals of palliative care? If you come to the point, exact the topic, these are some of the goals. Main palliative care program, the palliative care is mainly concentrating the controlling, relieving the symptoms. Right, I told the terminal illness patients, right, mainly come with severe pain, difficulty in breathing, and nausea, vomiting. Right, the palliative care team should concentrate on these symptoms. That's the main goal, rather than the terminal illness is very simple. One day or another they're going to die. Mainly thing is to improve the quality of life of the patients by controlling and treating the symptoms. Right, and of course I told improve the quality of life of the patients and regard dying as a normal process of life and neither as to postpone the death. Right, if you give proper palliative care, definitely can postpone. Even many studies are there, you can postpone the death of the patient by providing excellent palliative care services that you see in the next slide. Next, other goals like support holistic patient care and enhance quality of life, offer support to the patient to live actively as possible until death, right? Offer support to the family during patient's illness and their bereavement, right? And which are the diseases, the conditions that comes under palliative care? I told mainly the cardiovascular diseases, cancer, right? Chronic respiratory disease, AIDS, Alzheimer's, and dementia is very important. Along with this, other conditions like kidney, liver diseases, multiple sclerosis, rheumatoid arthritis, right? Neurological, drug-resistant tuberculosis, right? The team. Who are the team in palliative care? Main is the doctor, the nurse, social workers, chaplains, nurse, aides, dietitians, volunteers. All the members of the palliative care work together, right? Along for the improve the quality of life of the patient and the family too. Right. That will tell you later in yes. What are the barriers? Why I told at the beginning, why a lot of problems we are facing, why this concept of palliative care, why the people are not accepting the palliative care, many barriers in there. Number one is lack of trained palliative care providers, right? There's no proper training for the nurses and doctors, even they're facing, there's no proper concept. I told there's no national policy, there's no national policy also, even there's no proper training for these nurses, right? And inadequate palliative care education and training, late involvement in patient, especially in India, the patients will come to admit to the hospital at the end stage of the cancer or any other conditions. That's very important, very difficult to give the care also, to improve the quality of life also. And financial barriers, I told financial barriers. I faced this lot of problems, even lack of insurance facilities. Financial facilities are very, if the patient second, third stage of cancer patient admitted to the hospital, he has to spend lakhs of amount. He has to spend, he has to undergo for chemotherapy, radiotherapy, surgery. So all it will take lakhs of the right. That is very, very important. One of the I think you might have seen the movie. That movie is called as Padded Adam movie by name Williams. Has clearly mentioned in that movie, right? If you treat that disease, you will win or lose. If you treat the person, definitely will win, right? So here, why I am telling this, you have to sensitize the people. You can see, you can create awareness, you can understand the patient so that he can achieve that, right? And attitude and beliefs of the palliative care. I told, attitude is the main problem. Anyhow, I am going to die. The palliative care people, the doctor, nurse will come, they'll teach me and they'll do something, they'll give some drug, I have no use. Anyhow, I am going to die. Why to waste this bit of time? That type of attitude, that type of fear is there. One of the greatest, the eminent physician has told in India, right? The poor die in agony in negligency. The middle class die in agony in ignorance, whereas the rich die in agony on ventilators, right? So that type of attitude, so many are neglecting because of this the reasons. And of course, very important to have limited palliative care policies, right? Even many associations, many programs are there in India, palliative care programs. These are all the voluntary organizations. The fund is very difficult also, right? Next, policy and lacking geographical barriers, right? Transportation is very difficult to go to remote areas and giving the care, right? When to start the palliative program? Yes, this palliative program can start at early stage of disease if the patient present with the symptoms. From there you can start the palliative care program, right? This is a national consensus project. This is the one, the domains of palliative care program. This quality, this is what you can say, this the NCP guidelines. These are all the NCP guidelines. According to this, there are 8 domains of palliative care. These are all the 8 domains that we are going through now. The first one is structure and process of care. Second is physical aspect of care. Third is psychological and psychiatric aspect. So the fourth is social aspects. Fifth one is spiritual, religious and existential aspect of care. Sixth is cultural aspect. 7, care of patient near the end of the life of the patient. And the last one is ethical and legal aspect of the care. The first one is structure and process of the care. See, name only there is structure and process of the care. When the patient admitted to the hospital, the terminally ill patients like cancer or any other diseases, right? First, very important as a PC team, palliative care team, we can discuss with them, make an advanced care plan. We can explain about the disease progress, what are the treatment modalities available there, right? You can explain, see that you can understand where this palliative care programs are available after discharge from the hospital. This is about structure and process. And so they have to make a plan, all this assessing, diagnosis. See that the patient has to understand about the disease condition and where are the PC programs are available, right? And very important, this is physical aspects of the care. This is mainly concentrating, relieving the symptoms. I told the palliative program is the one is mainly improving the quality of life of the patients and relieving the pain. You know, the terminally ill patients, mainly suffering with the severe, moderate to severe pain. If you relieve the symptoms of the pain and also the dyspnea, definitely you can improve the quality of life of the patient. So we have to concentrate on that. So what are the main symptoms? Physical symptoms like pain, shortness of breath, fatigue, nausea, vomiting and constipation. These are the main, very, very especially the stomach cancer, other main cancers will have nausea, vomiting and constipation. Right? Yes, we have to evaluate as a PC care, as a palliative care team, we have to evaluate the pain. Pain is very important. I told how to, these are all the following methods you have to follow as a nurse also. One is comprehensive history, specific pain history, physical examination. So you have to assess, you have to use the certain instruments and tools for assessing the pain level. That is, I think you know, that is a numerical 1 to 10 scale and flat pain scale, Penag scale, and this is assessment of the pain, right? Whereas the another scale that is for assessing the, there are 2 main problems, pain and dyspnea. To assess the pain level, we can use this scale, numerical 1 to 10 scale, and RTOS 12 range for respiratory distress patient. Yeah, this is pain, prevalence of pain in palliative care. If the cancer patient having 75% of pain, moderate to severe pain, whereas cardiac congestive failure patients 28 to 70% of pain, COPD patients 21 to 77%, renal failure patients nearly 64% of pain, whereas stroke 68%. Yes, this is the according to WHO. This is the pain ladder, right? Pain ladder. This is the nurse is the one to how to control the pain by evaluating, by assessing the proper pain of the patient, right? So very important, she has to follow this ladder. The step one is mild pain, right? So she can give the opioid and like aspirin or other non-steroidal treatment. Whereas step 2 is moderate to severe pain. Very pain. So here she can start mild opioids and along with this non-opioids also. And the third step is it is severe pain, right? Uncontrollable, unbearable pain. Even the patient will collapse also. So even the patient will go for unconscious. Immediately the nurse has to start strong opioids by using especially the morphine, right? Psychological, yes. Once the patient is suffering with the pain and severe pain, definitely it affects the psychological. Once the patient admitted to the hospital, the patient will go for shock and will be in depression, anxiety because of pain, because of financial burden. These are the two main reasons. So because finance is very, I told already, the poor can die in ignorance. It's very difficult to, financially it's very difficult for him to go through that. So the anxiety, depression are very common. We have to, as a PC team, we have to assess the psychological aspects of care and have to refer that type of cases to the psychiatric areas. Social aspects of the care. Social aspects, that depends on the patients. I told already, if the patient is, especially the family members are the one having, their loved ones will be admitted there in the hospital, right? Before death, the patient wants to see his loved ones, maybe the teacher, maybe his friend, right? So regular social meetings are very, very important. So the palliative care team have to arrange the regular meetings along with the patient and the family members. If the patient is not well, if you're unconscious, the patient is not cooperating, we can call the surrogates and you can discuss with them, have a discussion with them, and you can, why the social aspects are very important here. If the loved ones will come and approach and talk, the patient will relieve. That's what regular meetings with loved ones is very, very important. Yes, spiritual, religion, existential aspects of care. Spiritual aspects is very, very important here. Spiritual, like religion, their customs and their beliefs. We have to, as a PC care nurse, we have to respect their religion, respect their culture, respect their beliefs, right? This point is very important here. So here, what you can do in the spiritual, that all depends on the patient. If it is a Hindu, their mentality is different. If the Christian, different. If they're Muslim, their mentality will be different. You have to follow certain principles while giving care to such patients, right? So they believe that they believe the God. So I want to pray the God before death, or I want my priest, the church from the priest from the church, or the head from the Muslim area, Muslims. So let me come and do the prayer. So you'll feel somewhat, you'll get the peace of mind. So we have to respect the spirituality of that. And very important here, the religion, if you consider, before death, very important. The Hindu people will believe, if I'll die, I can meet my ancestors in the heaven, right? And another one is, they want to pray the God before death, and they'll call the people from the temple and they'll apply kumkum or something. So maybe it is, maybe for somebody to maybe silly, but it is really, before death, let them die peacefully, right? You have to respect their spirituality, respect their religion, right? And that another thing is, the Christians believe that if the patient dies, Jesus will come and take the patient. My patient will take a rest under the protection of the Jesus, right? And the angel will come and take, and even the priest will come from the church and do the prayer at the bedside. It gives peace of mind, definitely peace of mind. And the Muslims believe that the angel of death, very important. That is called, I'm sorry I can pronounce that, Munkar, right? So he is the one. Yes, Malak Munar is the angel of death, right? They believe that this angel of death, this angel will come and they will test us before taking the soul. If the patient is bad or sinner, he will give a lot of problems. If the patient is bad, if the patient is good, he will take immediately the soul. Immediately will not take the soul. If it is a bad person, will create problem, the God will play with him. So they believe that. We have to believe that. Another after death, two people will come, two angels they will come. That is called Munar and Nakir. They believe that. Islamic traditions, they believe that these two angels will come. They believe strongly that, and they will test the faith of the patient. If the faith of the patient, if it is, they believe that once you will go to, if the bad person will go, the good person will go to the heaven, bad will go to the hell, and they'll have a, they can meet the ancestors there. So that type of beliefs will be there. We have to respect the patient. You may ask, maybe these are all very, very important, because they'll get the priest will come, the imam will come, right? The chaplain, Rabbi will come. They'll come and pray for some time. Peace of mind will get, patient will get peace of mind. And very important, after that, soon after that, and just before death, 1 or 2 days or 1 month, they'll call, the patient may call the, if it is, they'll transfer their property, and they'll call the advocate, right, in front of, especially in front of religious head, right, and to respect all such things, right. Next one is cultural aspects. I told this all comes under this only, previous slide only. So cultural, we have to, as a nurse, as a palliative care team, we have to respect the beliefs and traditions, right, and family caregivers, very well, and you have to respect to the surrogates, what is their customs and beliefs about their, what is their food, you know, in culture, in Hindu culture, just before death or soon after death, we can put tulsi water into the mouth. It is our tradition, our belief that, or put some water, right? So you will be happy, like, you will feel happy, the family members will feel happy for that. And yeah, this is very important. Care of patient just during that, right? Very important. This is, it is here the palliative care team has to play, should have a skills for that. Communication skills are important. We are going to announce the bad news. Yes, is going to die within 1 month or 2 days or 1 week. So the doctor will announce that. How to announce, the nurse or the doctor, very important, they should have a communication skills. How to announce the death, right? For that, they have to follow the SPIKES protocol. SPIKES protocol is very important. What is SPIKES protocol? Setting. Setting is the one. Setting means very important. Call the patient. If a patient is not available, patient is not ready because of his disease condition, you can call the surrogate or other family members, right? Call to one place, maybe in the hospital, right? And very important, the setting is very important. The setting should be like a house. Like they feel that if the patient is available, is well and good. If the family members or surrogates, they'll come, they should feel that it's like a heaven. Here, the doctor is going to announce the death, and also is going to show all the documents, what the reason behind the death, right? The setting is very important. See that there should not be any instruments, and you have to keep napkins, right? And provide water. That's type of settings, and you have to arrange flowers. The settings are very important. The patient, the family members of the patient feel really happy that during that time. And SPIKES protocol, another very, very important, perception of the patients and the family members, right? Perception, very important, how they perceive about their condition, right? About their illness, about the symptoms, right? We have to find out that. Next one is information, the invitation, right? We have to give the correct, complete, truthful information. Respect to the family and the patient, give truthful information. Doctor, I know I'm going to die within, whether I'm in the last stage of the cancer, I think I may die within 1 or 2 days, right? The way of telling is very important. Truthful telling is important. Yes, we are trying for other treatment modalities are there, nothing to worry. Some instead of telling, yes, you are going to die. Instead of that, truthful telling, giving respect to the patient's autonomy is very important here. Knowledge, the patient and the family members should have thorough knowledge about the disease condition, about any other interventions are there, further interventions. They'll ask. The knowledge is very important here among the family members. Doctor, whether you are going to start another chemotherapy, another radiotherapy, or another surgery. So they'll ask immediately. They'll say that all this may lead to decrease the quality of life, and it may harm them also. They may say it's of no use, it is waste of money also. So you have to give proper information, and they should have a knowledge about that, right? And empathy. Empathy is very important, and you should be truthful and be empathic to them. And last is summarize that. See that everything, what is the disease condition, about the interventions, the death, everything should give in detail, right? So that they'll have good knowledge and they'll be ready for if any problems, if anything, they'll ready for, even there's no much, there's a difference. If the person will die suddenly, our reaction will be different, right? If the person will die after 1 week and 2 weeks or 1 month, we are aware of that. The family members are aware of that. Yes, patient, my wife, my daughter, my thing, anybody, okay, sorry, family members, they are going to die because you are facing that. So you have, that's why they should have a knowledge about that. Then they can face it. They get ready for that. These are the SPIKES protocol, right? And last is ethical and legal aspects. Ethical and legal aspect, last domain is, right? You have to, as a PCK team, you have to follow certain ethics, certain ethical principles. I told already, you have to, very important, the legal documents, and very important, the truthfulness, respect, empathy. These are all principles you have to follow that, right? What happened under ethical these things. You are going to give the strong opiates. You as a doctor, as a nurse, you know that he is going to die within a week or 10 days. But you have to give. You know that if I give this, quality of life will come down. But you have to give that, right? There is a harm will be there, but sometimes improvement will be there also. You have to follow that certain ethical considerations also. So these are all about ethical domains of palliative care, right? So one last one I want to show one. Go back. One video is there. Just 1 minute. Wait. This is a video of the palliative care. That's what Dr. Rajgopal is.
Right across the world is that it has always originally developed in the community through volunteering and through donor support. And unfortunately, the state and governments tend to come in later. So it's really important in developing palliative care services that communities come together and demonstrate what can be done so that the government will then have to respond.
I'm here in front of the palliative care unit run by Trivandrum Institute of Palliative Sciences, which is run in collaboration between the non-government organization called Palli India and SUT Hospital, which is a private hospital here in Trivandrum.
India has around 360 palliative care units all over India, but out of these 360, 300 are in Kerala.
This is one of the hospitals run by SUT group of hospitals. They have given us a whole floor as their philanthropic arm, completely free. So this whole floor forms the palliative care units.
In Kerala, there are few things which actually took this forward in the last 10 years. One, there are a lot of neighborhood networks, so there is huge, massive community participation. Then Kerala's system of governance is different from the rest of India. We have a more decentralized system of governance, so the local government institutions have more power and money, so they can contribute. And also the Kerala is the only state which has a policy in palliative care, which supports community involvement in palliative care. And also the Kerala has liberalized the medical use of morphine, and it has taken it from the narcotics and it's now placed under the health department.
All treatment in this unit is completely free for 82% of our patients. 82% because that's the way it happens. We class them when they come in, following the initial clerking according to their financial status. Anybody who is classed as poor or very poor get all treatment free, including free drugs for palliative care.
When we started here, we started just with some home care activities alone. Now, yearly we are looking after 4,000 to 5,000 patients here. It is a community-based work.
All the professional fee paid by the patients here, we put back into the general kitty because we find it a bit hard to raise enough funds.
The society, this can get translated into a proper action plan, and again that any right-based movement will have to start at the grassroots level from the common. It cannot bring a human rights movement or action plan.
If there is no public demand, hospitals and the medical system will continue to do what is most profitable to them, what they find more interesting. Unless the common man demands the right to freedom from pain, I believe the doctors and nurses will not have the motivation to do something about it.
Thank you. This is a video, simple video. And finally I request, there are teachers, nursing teachers are there, principals are there, faculty are there. My wholehearted request for all of you, please see that our nursing student should be in wards, especially they should aware, please sensitize. Finally, and my wholehearted thank you so much, Dr. Deepti Shukla. Thank you so much, madam, for giving this opportunity. You were no doubt you were a good human being, wholehearted. You were a legend and excellent arrangements. My wholehearted congratulations to you. Wholehearted once again, thank you so much for calling me, for inviting me for this. I hope as a PhD nurse, I'm not that much aware of palliative care. Even many are not aware of that palliative care program, right? So even because of her, really I'm telling, since 10-15 days I've done a little research on palliative care. Thank you so much for giving this opportunity. And my special thanks goes to Dr. Santosh, who has called me 15 days back and is venerated me. Thank you so much, Santosh. And I wish all the best, dear students, my beloved students. Right? Take care of you. And finally, I know the sufferings of female women. Please don't feel bad, don't feel shy. Please go for regular checkups, especially breast self-examination. If any problem, share with your faculty, share with your brother or father, the mother or father, whoever it may be. Don't neglect that. My request, sincere, my request to all of you, because me as a senior most in PhD, I lost my wife because of because of ignorance. Right? Thank you so much, all of you. Good day.
आवाज कहाँ गया है? Where are you people? Hungry? Okay, so I feel it's a second home to me. Frequently I am coming to Samarpan instead of nursing science, and Dr. Deepti Shukla madam, grateful to you for calling me. And today international conference, what we are discussing is most important and in future. So last 3 months before also we have attended one workshop that was a national conference that was on forensic nursing and palliative care. See, these two are how madam is choosing the topics. आप लोग समर्पण इंस्टीट्यूट का आप दिशा देख लीजिए, जहाँ नर्सिंग जा रहे हैं, जहाँ मेडिकल जा रहे हैं, जहाँ इंडिया जा रहे हैं, वहाँ पकड़ रहे हैं मैडम. So really it's a great effort you are putting. I would like to convey my regards to Dr. K. Ramu sir, former Dean of Rajiv Gandhi University of Health Science, for briefing a wonderful presentation on palliative care, and he has given nook to corner of the palliative care. And before starting my concluding remarks, we cannot change the outcome, but we can affect the journey, that is the nursing palliative care. So sir was started the palliative care and correlated with the hospice care. So both are vice versa, and he said a brief history about the palliative care and what was the global view of palliative care. Sir was saying about other countries, can anyone, if you are going for the question and answer, so can anyone tell me which is the country is leading in palliative care?
England.
UK and USA. Okay, so out of 81 countries, UK has got first rank, highest score among these for providing the end of life care. So I think you people are carefully, cautiously listening to the class. And also sir explained about palliative care aspects in India. Unfortunately, Medical Council of India and Indian Nursing Council not showing much interest and were unsuccessful in implementing the palliative care, the curriculum, but still the issue is in the court that will be coming soon. And sir has explained models of palliative care, and on one state, that is Kerala, having 60 units and 12 million population they are serving. And their sir was explained about Indian Association of Palliative Care and what are their goals and objectives, and also palliative care team. So can any one delegate from the last benches who are all present in the palliative care team? कौन-कौन रहना चाहिए palliative care team में? Nurse? Can anyone pass the mic? Yes? Because we need to know how attentive you are in the presentation, because organizing the conference is the biggest part, but the second half, how much we are sending the message to you and how much you are taking home the message. So just to check, yes, any? Yes. Wait a minute. First introduce about yourself, from where you are, and answer to the question which was asked by me, palliative care team members.
Good afternoon, sir. Good afternoon, everyone. I am Ms. Stuti Malviya from GSVM Medical Nursing College, Kanpur, and my specialty is mental health. So, as the palliative care team, so the members are doctors, nurses, social workers, dietitians, and chaplains. They are religious spirituals. They give religious motives to the person and spiritual support to the person.
Exactly. So give her a round of applause for Stuti Malviya. So nicely you have understood the class. And sir was started with the issues and barriers of palliative care in India and abroad, and also national consensus domains of palliative care. Can anyone tell me how many domains are there in the palliative care? Yes sir. Yes sir. So, very good. It's 8 domains. Okay. अब बताइए कौन कौन सा है? First one कौन सा है? Very good. Structure and process of care, physical aspects of care. Yes.
Good afternoon, one and all present. Good afternoon, sir. Myself, Madhulika. I am a MSc nursing first year student from the GSVM Nursing College, Kanpur. The 8 domains are structure and process of care, physical aspects, psychological and psychiatric aspects, social aspects of care, spiritual, religious and essential aspects of care, cultural aspects of care, care of patient nearing the end of life, and ethical and legal aspects of care.
Very good. So give her a round of applause. Sir, your class was effective. Okay. No. I'm not judging. I am just remembering the students and their sir, because sir is the most experienced and volatile personality what we have seen from our childhood. When we started nursing, we are seeing him. Okay. So nice. One more question I will ask. Why Kerala state is having more and more palliative care centers than other states? कोई बताएगा? Okay. Because it's a general question. More nurses. Palliative care में exactly. Deepthi madam is given the right. Madam, you are the conference chair, so you cannot answer. Okay. I would like more delegates to answer, but it is the right answer, madam has said. And also there are many other issues, many other points we can say for Kerala. Kerala is a birth for nurses and care, where we can see most and most fundamentals of nursing में आपने कौन सा book पढ़ा है? Which book you are studying for fundamentals and foundation? So Sister Nancy, okay. सब लोग, सभी ने देखा उस book को? कोई एक स्टूडेंट है सिस्टर नैन्सी बुक देखा नहीं? सब ने देखा. So कहाँ से आया वो? तो ऐसे. So it is taken birth from there, and we are seeing all the procedures, all the things, everything we are studying from there. And also second thing, whomever studying degree UG or PG, they are going abroad. उनका पेरेंट्स को देखने के लिए लोग नहीं रहता है, so palliative care ऑप्ट करना ही पड़ेगा. उसके अलावा they are more advanced and 10 years ahead from other states. So 10 साल के बाद हम क्या देखते हैं यूपी, एमपी, बिहार में, वो आज देख रहे हो लोग. Okay, so this is a collectively I can say comprehensive class is given by the Dr. K. Ramu sir about palliative care, and he has in 45 minutes of time he has explained each and everything, and I hope the students has understood very clearly. So before completing, there is an end to cure. There is an end to cure. There is no end to care. There is no end to care. So this is evergreen. You can continue the care. So this is with this I would like to convey my regards to the management of Samarpan Institute of Nursing and principal ma'am and all the my senior fellow nursing faculties and resource persons, principals and faculty members, delegates, and my friend Santosh and Dr. Ramu sir. Thank you so much. Thank you for giving me the opportunity.
Thank you, sir. Now I would like to request Professor Dr. P.T. Kaul ma'am and also our principal ma'am, Dr. Deepti Shukla. Please ma'am, both of you kindly come on stage. I request our principal ma'am. I request Navina J. sir. Thank you, sir. Thank you, ma'am. For the next session, for the next session, I would like to invite on a dais Miss Catherine Janelle. Ma'am is a social worker from Australia. Ma'am, kindly please come on a dais. I also request Mr. Tom Janelle. Sir, please. Come on, guys.
So she is not that Catherine who is mentioned here in the program. This Miss Catherine Deeve, she will take the session on 10th due to some very emergency in her home. Okay, so here we have another Catherine, and she is a fantastic lady, and the family, whole family. ये अच्छी हिंदी बोलती है, थोड़ा हम भी हिंदी में बोलेंगे. कैथरीन की फैमिली हमारे इंडिया में होमलेस पीपल को सर्व करते हैं, उनकी हेल्प करते हैं इन रिगार्ड्स टू देयर मेडिकल हेल्प. They are fully devoted. She, her husband and 2 young children. Husband and one boy is not here, but mother and boy is here. Please welcome to the round of applause. First, I would like to welcome you with the floral bouquet. is having 4 or 5 members along with her, and she will introduce one by herself. Yes, आप खुद से बताएंगे. I will tell little bit about madam and then she will be carry on. कहाँ से करूँ बेटा? Okay. So Catherine Derek, she studied BSc and MSc, but has devoted her adult life to community service. First with the disadvantaged youth in Australia, then she shifted to India for the urban poor people. She has lived with her husband and 2 sons in poor neighborhoods in Delhi and Lucknow for 2 decades. For 2 decades. Her current focus is on developing community-based patient-centered approaches to reducing the burden of tuberculosis in urban slums. Yes. And here is the Mr. Mark Denelli. He is the husband of Madam Catherine and has studied commerce, law and international development. He has a wealth of experience in training NGOs to educate with and the poor to access the services they need to improve their own lives. His current focus is on supporting slum-based literacy classes and facilitating solutions to community-wide issues. Mr. Tom Dillett was born and grew up in Delhi. So he is Indian? You are Indian? Bilkul. Jai Hind. Jai Hind from Tom. And thinks of India as home. He coordinates the Mila project in Nai Basti, which provides local residents with assistance in medical needs, Hindi literacy and securing government entertainment such as pensions and disability certificates. His focus this year is on tracking corruption in government hospitals and other systems level changes to benefit to the poor. बहुत बड़ा बर्डन ले लिया टॉम, गवर्नमेंट को लाने चले हैं. अरे बाबा. And along with these 4, they have a good team working with the slum people. And this is a team, mother, father, and 2 young children. And for the further things, I will like to call Catherine ma'am to come forward to introduce what exactly your performance is there and आप क्या क्या कर रहे हो. Hi.
और फोटोस हम थोड़ा शॉर्ट फॉर्म में ही बता देंगे, तो फिर कुछ में हम ज़्यादा बातें बता देंगे. तो फिर हम पहले इसी स्लम में रहते थे दिल्ली में, और तो फिर उसका वो हटने के लिए नोटिस हो गया, तो फिर वो हट गया. जहाँ टॉम वहाँ जब 5 साल का था, यही टॉम है जो आज आपके सामने है. वो जब 5 साल का था वो वहीं खड़ा हो रहा है जहाँ पे हमारा घर था. सारे बस्ती हट गया. तो फिर हम उसके बाद ईस्ट दिल्ली शिफ्ट हो गया है. और ये जहाँ हम मतलब ये जिस दिन मैं पहली बार अपने नीस से मिले हैं, उसका बेटा बाद में उसको लुकीमिया हो गया था. वहाँ रहते रहते बस्ती में हम बहुत लोगों को देखते हैं जिसके बहुत सीरियस हाल है. अलग अलग वो सेहत की दिक्कत है, उनका तो बहुत बोझ बन जाता है, बहुत खर्चा हो जाता है, बहुत ज़िंदगी में नुकसान हो जाता है. तो बहुत ऐसे लोगों को देखने को मिला और दोस्ती मतलब हमारी दोस्त बन गई. तो फिर ये जब दोनों बच्चे थोड़ा बढ़ते जा रहे हैं, वो हमारा घर था और घर में ही बैठ के स्कूल का काम करते थे. यहाँ पढ़ लिया है. टॉम ने 10वीं पास किया है हिंदी में और उर्दू में. बहुत बढ़िया. हमारे से ठीक है. ये है वही नदीम जिसके बाद में उसका इंतकाल हो गया था लुकीमिया से. बहुत दुख की बात है. बहुत गरीब लोग कितनी मेहनत किया है, फिर भी बचने जाते सब लोग. तो फिर ये राइट साइड पे ये है शमीन जो हमारे साथ हमारी स्टाफ टीम में है. वो बच्चों को पढ़ाते हैं. लिटरेसी हमारे साथ जुड़े हैं 8-10 लोग हैं जो बच्चों को पढ़ाते हैं और मतलब हॉस्पिटल में दिखाते हैं लोगों को और मतलब उसके पेंशन वगैरह इन बातों में मदद करते हैं. ये हमारे घर जहाँ पहले रहते थे दिल्ली में. ये अभी कोविड के वक्त आ गया. कोविड के वक्त हम लोग ऑस्ट्रेलिया में थे छोटा बेटा का कॉलेज में एडमिशन करवाने के लिए. कोविड का वक्त टॉम यहाँ था तो उसको तो मतलब कोविड का पास मिल गया है लोगों की मदद करने के लिए. मतलब बहुत लोग ऐसे निकले जिसके तो बहुत सीरियस हाल हो रहा है, लेकिन फिर हॉस्पिटल नहीं पहुँच पा रहे हैं, सब कुछ बंद है. घर से निकला तो फिर पुलिस से डांट खाना पड़ता है. तो फिर बहुत मरीज ऐसे ही घर में मतलब बहुत दिक्कत में थे. उस वक्त खाना का भी बांटने का इंतज़ाम हो गया है. बहुत लोकल लोगों से बाहर लोगों से भी मदद की है लोगों को खाना का मतलब लोगों तक खाना पहुँचने में. और ये अभी तक हमारी बहुत अच्छी दोस्त बन गई हैं। आप देखते हैं ये 2020 वाली फोटो लेफ्ट साइड पे है, उसमें जो पीछे बैठी है कितनी पतली है, वो तो 21 किलो तक कम घट गई, उसको मेनिंजाइटिस टीबी, तो फिर बहुत ही सीरियस हाल थी और हम सोच रहे थे कि बच नहीं पाएंगे, लेकिन खुदा का शुक्र वो बच गई है। बहुत मेहनत की है उसके हस्बैंड ने और टॉम ने और कुछ दूसरे काम के साथ हैं, और वो तो 2021 में तो थोड़ा बहुत ठीक तंदुरुस्त है। आजकल तो वो 21 किलो से दुगना हो गई, 40 किलो से ऊपर हो गई है, बहुत अभी ठीक हेल्थ है उसकी। बच्चों को पढ़ाने के अलावा हम उनको पार्क में आउटिंग्स में भी ले जाते हैं, अलग अलग काम करते हैं। और देखो शायद टॉम कुछ बता देंगे एंटाइटलमेंट्स के बारे में। वहाँ देखो टॉम बैठ के फॉर्म भर रहे हैं लोगों के।
थैंक यू अम्मी। तो हम भी आपसे हिंदी में बात करने की कोशिश करेंगे, बट ज़रूर हमारी हिंदी में कुछ गलतियाँ निकलेंगी, तो प्लीज़ आप बताइए ना, हम हमेशा हिंदी सुधारने की कोशिश करते हैं। तो बेसिकली हम लोग आज आपके साथ में हैं, हम नर्स नहीं हैं, हम डॉक्टर नहीं हैं, राइट? हम आपसे सीखने आए हैं नर्सिंग एंड डॉक्टरी के बारे में। अभी हमने सर का सेशन सुना पैलिएटिव केयर के बारे में, बहुत अच्छा लगा। बट हम क्या ऑफर कर सकते हैं आज? एक पर्सपेक्टिव, एक दृष्टिकोण जो बस्ती से आती है, राइट? हमारे साथ में एक कॉलीग है मंतशा, अभी हम उनको भी बुलाएंगे यहाँ पे बात करने के लिए। मंतशा खुद बस्ती की है, राइट? और वो बस्ती की लोगों की विकास के लिए काम कर रही है। हम भी मान लीजिए बस्ती के हैं, आपने सुना मम्मी से कि हमारी बचपन भी भारत में ही हुई, तो हम आपको ये दृष्टि दिखाना चाह रहे हैं कि बस्ती के लोग यानी झोपड़पट्टी के लोग अक्सर सरकारी स्वास्थ्य सेवाएं क्यों उपलब्ध नहीं करा पाते हैं, क्यों उनको ये हासिल नहीं होती हैं, राइट? यहाँ पे मैं बहुत खुश हूँ कि इतने नर्सिंग स्टूडेंट्स हैं, राइट? और इतने नर्सिंग प्रोफेसर्स भी हैं, क्योंकि आप लोगों का भूमिका बहुत ही आवश्यक है, बहुत ही ज़रूरी है इस देश की विकास के लिए, राइट? देश की विकास के लिए स्वास्थ्य बहुत ही ज़रूरी है। तो हम आज का छोटा सा सेशन हम एक रोल प्ले भी करेंगे आपके साथ, छोटा सा नाटक करेंगे, हम आपसे काफ़ी प्रश्न पूछेंगे, हम आपके विचार सुनना चाहते हैं, क्योंकि मुझे लगता है कि चाहे हम कितने भी अच्छे डॉक्टर हैं, चाहे हम कितने भी अच्छे नर्स हैं, हमारी टेक्निकल स्किल्स होनी चाहिए ज़रूर, बट साथ में हमारे एक कम्युनिटी के साथ जो व्यवहार होता है, जो लोगों से बातचीत करने का व्यवहार है और जो लोगों को एजुकेट करने का तरीका है, वो भी हमारे लिए बहुत ही ज़रूरी है, राइट? तो ये हमारा मेन फोकस है आज के सेशन पे। मैं वेरी ब्रीफली मैं आपको एक छोटा सा कहानी सुनाना चाहता हूँ शुरू करने से पहले, कि यहाँ पे हमारे दोस्त हैं फिरोज़, राइट? फिरोज़ जब वो 6 साल का था, वो एक पेड़ से गिर गया, राइट? एक ऊंचे मान लीजिए 2-3 मीटर की ऊंचाई से वो गिर गया और उनका पैर टूट गया, राइट? टूट कर मतलब ऐसे मुड़ गया और उनका जख्म ऐसे था कि उनके पैर चिपक गए, तो उनकी अपर लेग एंड लोअर लेग आपस में चिपक गए। तो फिर वो पिछले 18 साल से ऐसे कूद के चल रहे हैं, आप ऐसे समझ सकते हैं कि वो डंडी के साथ चल रहे हैं, उनका पैर ऐसे मुड़ा हुआ है। तो जब हम उनके लिए विकलांगता सर्टिफिकेट बनवाने के लिए गए थे, राइट, डॉक्टर्स ने बोला कि एक्चुअली हम इसको सही कर सकते हैं, और प्लास्टिक सर्जरी होगी, ऑर्थोपेडिक सर्जरी होगी और इस टांग को सही किया जा सकता है। आप यहाँ पे फोटोज़ में देख सकते हैं जो उनके ऑपरेशन के बाद टांग में मेटल रॉड पड़ी थी, राइट? फिर उस टांग को सीधे किया गया, धीरे धीरे एक दिन पे एक स्क्रू घुमाया गया और धीरे धीरे उनका पैर सीधा हुआ। ये उनका रॉड जो उनका जख्म था ऑपरेशन के बाद, आखिर में उनके रॉड्स निकल गए, उनके पैर सीधे हो गए और अभी वो फिजियो करते हैं, राइट? वो दोबारा चलना सीख रहे हैं, वॉकर का इस्तेमाल कर रहे हैं। तो बहुत जो आप लोगों ने काम चुना है, राइट, अपने ज़िंदगी के लिए, नर्स का काम या डॉक्टर का काम, ये एक बहुत ही अच्छा काम है और इस काम में जिस तरीके से लोगों की सेवा करने का मौका मिलता है, राइट, उससे इतनी अंदर खुशी मिलती है। जब हम फिरोज़ जैसे लोगों के मुंह पे मुस्कान पे चेहरे पे मुस्कान देख सकते हैं, तो अंदर से बहुत खुशी और संतुष्टि मिलती है, बहुत सेटिस्फैक्शन मिलता है। तो मैं बहुत ही खुश हूँ आप लोगों के साथ कि आपने अपने ज़िंदगी में ऐसे करियर चुना है, राइट? इस कहानी में मैं ये ऐड करना चाहता हूँ कि क्योंकि फिरोज़ इतने गरीब फैमिली से आते हैं, राइट, वो एक झोपड़पट्टी में रहते हैं जो रेलवे पटरी के किनारे हैं। उनके ज़िंदगी में, उनकी लाइफ में काफ़ी कठिनाई आए, जो शायद उनके डॉक्टर और नर्स समझ नहीं पाए। फॉर एग्जाम्पल, डॉक्टर ने बोला कि आप एक हाई प्रोटीन डाइट लीजिए। हाई प्रोटीन डाइट मतलब अंडे, मछली, गोश्त, राइट? ठीक है, हमें बोलना आसान है, बट पेशेंट की कमाई नहीं है, पेशेंट अब काम नहीं कर पा रहे हैं, उनके लेग ऐसे हैं, टांग ऐसे हैं, 3 महीने से काम नहीं कर पाए, तो वो हाई प्रोटीन डाइट कहाँ से ले सकते हैं, राइट? मुश्किल है उनके लिए। सेकंड प्रॉब्लम, डॉक्टर ने कहा फिजियो कीजिए। ऑब्वियसली बहुत ज़रूरी है फिजियो करना, कसरत कीजिए, अभ्यास कीजिए, पैदल चलना। बट वो एक रेलवे पटरी के किनारे रहते हैं, एक झोपड़ी में, वहाँ पे ज़मीन बहुत ऊबड़ खाबड़ है, वहाँ पे हमारे लिए भी चलना मुश्किल है। आप या हम चलेंगे वहाँ पे तो हम फिसल के गिर सकते हैं, और ये आदमी अभी नया चलना सीख रहे हैं, तो उनके लिए काफ़ी मुश्किल है। मैं ये कहानी इसलिए शेयर कर रहा हूँ क्योंकि डॉक्टर और नर्स का काम बहुत ही ज़रूरी है, बट साथ में हमें थोड़ा सा समझना है कि हमारे मरीज़ किस परिस्थिति से आ रहे हैं। चाहे हम कितने भी अच्छे दवाई प्रिस्क्राइब करेंगे उनके लिए, चाहे हम कितने भी अच्छा फिजियो बताएंगे, डाइट बताएंगे, अगर हम उनकी परिस्थिति नहीं समझ सकते हैं कि वो कहाँ से आ रहे हैं, उनकी कॉन्टेक्स्ट क्या है, उनकी फैमिली कैसी है, उनकी बस्ती कैसी है, तो वो शायद हमारे एडवाइस को फॉलो नहीं कर पाएंगे, राइट? तो एज अ नर्स, एज अ डॉक्टर, ये हमारे लिए बहुत ज़रूरी काम है कि हम मरीज़ों की कॉन्टेक्स्ट, उनकी परिस्थिति समझें, ताकि हम उसी हिसाब से उनके इलाज में मदद कर सकते हैं। तो ये हमारा आज का सेशन है। आई होप आपको बहुत मज़ा आएगा इसमें। हम रोल प्लेस करेंगे, आपसे कुछ सवाल भी पूछेंगे, राइट? इससे पहले मैं मंत्रिशा को भी इनवाइट करना चाहता हूँ यहाँ पे कि मंत्रिशा भी अपना परिचय दें। तो वेलकम मंत्रिशा प्लीज। मंत्रिशा पिछले 2 साल से हमारे साथ काम कर रही हैं बस्ती में, बहुत मेहनती हैं, और ये बेचारी अभी पिछले हफ्ते 1 AM तक, मतलब रात के 1 बजे तक थी हॉस्पिटल में एक मरीज़ की मदद करने के लिए। तो बहुत ही मेहनती है ये। और मैं मंत्रिशा से पूछना चाहता हूँ एक छोटी सी कहानी जो आप देख सकते हैं यहाँ पे, मंत्रिशा का फोटो। तो मंत्रिशा, क्या आप बता सकती हैं अपने बारे में 2 लाइन, और फिर आप बताइए कि आप इस पेशेंट के साथ हॉस्पिटल क्यों गई थी?
मेरा नाम मंत्रिशा है और मैं देवी संस्थान के साथ 2 साल से काम कर रही हूँ। और कैथी आंटी जो कि टीवी पर काम कर रही हैं, तो वो लोग स्लम बस्ती में सर्वे किए, ऐसे काफ़ी बच्चे इनको दिखे जो जिनकी हाइट नहीं बढ़ रही है, जिनकी हेल्थ नहीं बढ़ रही है क्योंकि उनका खान पान अच्छा नहीं है, और जिसकी वजह से वो काफ़ी दिक्कत में है। तो हम डॉक्टर के पास गए गवर्नमेंट हॉस्पिटल में, तो उनसे बोला कि डॉक्टर साहब इनकी हाइट नहीं बढ़ रही है और हम ऐसी ऐसी संस्था से हैं और हम इनको लेकर के आए हैं आपके पास, आप प्लीज़ बताइए कि इनके साथ क्या करना चाहिए, इनके लिए कोई दवा दीजिए। तो जो वहाँ पे सीखने वाले डॉक्टर बैठे थे और जो सीनियर डॉक्टर बैठे थे, तो वो तो कुछ नहीं बोले, वो बस यूँ किए। फिर जो सीनियर डॉक्टर हैं उनसे एक दवा लिखवा दिया। हमें तो नॉलेज नहीं है दवाइयों के बारे में, तो वो आप ही जान सकते हैं। तो बाद में उन्होंने पूछा कि डॉक्टर साहब ये किस चीज़ की दवाइयाँ हैं, तो उन्होंने कहा बस कीड़े की दवाइयाँ हैं। तो उन्होंने कहा कीड़े से क्या उनकी हाइट बढ़ जाएगी? तो वो बोले कि नहीं देखिए ये खिलाइए, अगर उनको ठीक लगता है तो ठीक है दोबारा आइएगा, वरना मत आइएगा, इनको कहीं दूसरी जगह दिखाइए। पर फिर आ करके मैंने टॉम से बात किया कि ऐसी ऐसी बात है, ये चीज़ है। तब टॉम ने बोला कि इनको दूसरी जगह दिखाना चाहिए या दूसरे वहाँ पे हॉस्पिटल में दिखाना चाहिए। तो फिर हम लोग कहीं नहीं ले जा पाए, फिर टॉम उनको लेकर के खुद गए। तो ये इनकी कहानी है।
थैंक्स मंत्रिशा। तो मंत्रिशा जैसे लोग बहुत ही मेहनत कर रहे हैं बस्तियाँ में, जो कम्युनिटी हेल्थ वर्क है, राइट, जो आपके लिए भी एक बहुत इम्पोर्टेंट हिस्सा है नर्सिंग का, कि आप केवल हॉस्पिटल में काम नहीं कर रही हैं बल्कि आप बस्ती में जा रहे हैं, गांव में जा रहे हैं, लोगों को अवेयर करा रही हैं, राइट। हम खास तौर पर इसी विषय पे आज चर्चा करना चाहते हैं। तो इसके लिए शुरुआत में हम एक छोटा सा रोल प्ले करने चाहते हैं, एक छोटा सा नाटक, राइट, 2 मिनट की नाटक है। मैं रिक्वेस्ट करता हूँ कि आप लोग ध्यान से देखिए, राइट, और फिर हम आपसे कुछ प्रश्न पूछेंगे इसके बारे में कि आपको क्या लगा, आपको क्या देखने को मिला इस नाटक में। तो इस नाटक के लिए, राइट, ये एक फैमिली प्लानिंग सेशन है, राइट। हमारी बस्ती में जो अभी हुई थी, हमने डॉक्टर को बुलाया था कि आप प्लीज़ आइए हमारे स्लम में और फैमिली प्लानिंग सेशन कराइए। तो इस नाटक में मेरी मम्मी डॉक्टर है, राइट, और मंत्रिशा और हम भी एक औरत है, राइट, हम भी एक लेडी हैं इस नाटक के पर्पस के लिए, और हम यहाँ पे आए हैं, डॉक्टर आई है हमें बताने के लिए फैमिली प्लानिंग के बारे में। तो प्लीज़ तो प्लीज़ ज़रा सा आप लोग देखिए और बाद में हमें फीडबैक दीजिए, हम आपसे प्रश्न पूछेंगे, राइट, कि आपको क्या देखने को मिला इस रोल प्ले में।
अच्छा, वो मैं नर्स हूँ, आप लोग हथियार हैं? छोटे बच्चों को तो भगा दो ना, ये छोटे बच्चों को बड़ी बात नहीं है। ठीक है, और डॉक्टर मैम आ रही हैं, कोई आपके घर में कुर्सी है? डॉक्टर कहाँ बैठेंगे?
अच्छा मंगाते हैं। चलो कुर्सी आ गया डॉक्टर साहब के लिए। ठीक है, बहुत बढ़िया। और फिर वो फैमिली प्लानिंग वाले सामान रखने के लिए क्या कोई जगह? मेज भी नहीं है हमारे पास, बट तखत पे बिछा दीजिए आप। ठीक है, तखत पे बिछाते हैं। ठीक है, अभी डॉक्टर तो पहुंचने वाले होंगे, मैं डॉक्टर को मिल के ले आऊंगी। ठीक है, आप लोग बैठे रहो, तैयार रहो। चलिए देखते हैं, आज डॉक्टर कुछ अच्छे बताएंगे लग रहे हैं।
लग रहा है मुझे भी बहुत अच्छा बताने वाले हैं।
काफी कुछ सीखने को मिलेगा आज, लग रहे हैं।
इतने ही लोग हैं? ठीक है, आ गए सब लोग? ठीक है, तैयार? ओके, आज फैमिली प्लानिंग के बारे में बात करना चाहते हैं। आप लोग ज़्यादा बच्चे न हो जाए, 2 बच्चे ही ठीक हैं। ओके, तो फिर एक बात, आप नसबंदी तो कर सकती हैं, तो फिर पूरे ज़िंदगी के तो आपको दिक्कत नहीं होंगे। या तो आप कॉपर्टी लगा सकती हैं, इससे आपको 5 साल के राहत है। या तो आपका अगले दिन कुछ किया नहीं, तो फिर ये इमरजेंसी वाला टैबलेट अगले दिन 24 घंटे में खानी है। या तो आपका ये वाला रोज गोली खा लो, जब तक की गोली खाते रहोगी आपको तो बच्चा नहीं होगा, नहीं तो आप जब रुक लेंगे तो तब भी बच्चा होगा। या तो कॉन्डोम भी बहुत बढ़िया है, अब हमारे यहाँ से तो फ्री में मिल जाएंगे, लेकिन कॉन्डोम का तो ये कमी है, मतलब आपको हस्बैंड का तो राजी होना है।
तो बहुत मुश्किल है।
और कॉन्डोम कभी फट जाते हैं, तो इसका ये भी दिक्कत है। या तो आप वो इंजेक्शन भी लगा सकते हैं, आपको तो हर 3 महीने बाद आपको इंजेक्शन लगाना होगा, और तो फिर आपको फ्री है, राहत है। ठीक है, बस सब कुछ समझ में।
मैम ये हमारी सहेली ये प्रेग्नेंट है अभी, बट इनके पैर में सूजन बहुत आ रहे हैं, जरा देख लीजिए इनको एक बार।
अच्छा, आप दोबारा प्रेग्नेंट हो गई है? आपके तो 2 बच्चे हो चुके हैं ना? जी, 2 बच्चे हो चुके हैं। क्या बात है, तीसरे बच्चे की क्या जरूरत है आजकल की जमाने में? मतलब बहुत महंगाई होती है, 2 बच्चों को ठीक से खाना खिलाना पढ़ाना तो बस है जी। तो आप लोग हमारे पास तो आते हैं, तो फिर हम ये सारी चीजें हम फ्री में दे देते हैं, आपका तो इतना टिकट नहीं हो जाते हैं। जी ठीक है, ओके, बढ़िया।
डॉक्टर साहब अगले बार से ख्याल करेंगे।
ठीक है, वो नर्स साहब ने फोटो खींचा ना? ठीक है, 2 फोटो खींच लिया? ठीक है, काम हो गया है, वेरी गुड, थैंक यू सर।
ओके, फैंटास्टिक, शुक्रिया हमारा छोटा सा नाटक देखने के लिए। कैसे लगा आपको? ग्रेट। तो मैं ये माइक फ्लोर पे पहुंचाना चाहता हूँ। मैं आपसे 1-2 सवाल पूछना चाहता हूँ कि आपने इसमें क्या क्या देखा। उनसे पूछना चाहता हूँ, आपने इस रोल पे में देखा, आपको क्या अच्छा लगा इसके बारे में? मतलब क्या सही था डॉक्टर के बोलने के तरीके में, या जो डॉक्टर ने जानकारी दिया, क्या अच्छा लगा? और क्या आपके कोई सजेशंस हैं इम्प्रूवमेंट के लिए कि डॉक्टर या नर्स क्या और भी अच्छा कर सकते थे? तो माइक जा रहे हैं फ्लोर पे, आई थिंक। तो प्लीज, इंटरैक्टिव सेशन है आज, राइट? तो हम आप लोगों से विचार सुनना चाहते हैं, आपको क्या अच्छा लगा इसमें, या क्या सजेशंस हैं डॉक्टर के लिए कि वो क्या और भी बेहतर कर सकती थी? यस, प्लीज माइक पहुंचा दीजिए। एंड मैं आपके लिए ताली बजा रहा हूँ क्योंकि आपने सबसे पहले जवाब दिया। हमेशा जो सबसे पहले है वो सबसे बहादुर है। सो फैंटास्टिक, प्लीज।
थैंक यू सो मच। हर चीज़ के बारे में, हर कॉन्ट्रासेप्टिव के बारे में एक्सप्लेन करना चाहिए, क्योंकि वो लेमैन थे, उनको समझने में थोड़ा टाइम लगेगा। शी शुड एक्सप्लेन एवरीथिंग, किस तरीके से होगा, क्या होगा, कितना टाइम लगेगा, ये बहुत फास्ट रहेगा। When she was the lady who was pregnant, उसके बारे में उन्होंने ध्यान ही नहीं दिया, whereas उसको बताना चाहिए था कि उसको साइलेंट सिम्टम्स क्या हैं, उसे क्या करना चाहिए। इनफैक्ट PSC या CSC या किसी भी लेवल पे कहाँ पे जा सकती है, उसको गाइडेंस की जरूरत है। And photo thing should not happen actually in the community. We are working, we are giving care, we are not, publishing.
Sure. Okay, great. Thank you. Very good. तो 3 suggestions तो नहीं की सर. Excellent. Very good suggestions. Anybody else? और आप लोगों ने क्या देखा? Yes. इनके पास.
तो सर अगर हम कम्युनिटी एरिया में जाते हैं तो हमें अकॉर्डिंग टू सिचुएशन वो करना है. चेयर लाओ या ये चीजें नहीं होनी चाहिए. बिकॉज सर अगर आप इतना सुपीरियर अपने आप को दिखाओगे तो वो कंफर्ट नहीं होगी. आपको उनके अकॉर्डिंग, मतलब अगर उनके पास चेयर नहीं है, क्या नहीं है, तो आप इतना सुपीरियर वो आपसे अपनी क्वेश्चन को रिवील नहीं कर पाएंगे कि प्रॉब्लम क्या है. आफ्टर आंसर आपको फ्रीली जाना है. नमस्ते उनकी लैंग्वेज में जिस तरह वो हैं, नमस्ते, जय श्री राम जैसे भी बोलते हैं, बोल करके और उनकी लैंग्वेज में उनसे बात करना है. प्लस सर अगर वो कॉन्ट्रासेप्टिव, जैसे कि मैम ने बताया कि कॉन्ट्रासेप्टिव के बारे में अच्छे से बता करके और उनसे ये चीज़ बताना है कि इसके पहले अगर आपने कब ली, क्या क्यों नहीं लिया, इस चीज़ के बारे में उनसे क्वेश्चन, पहले तो उनसे क्वेश्चन रेज करना है कि क्यों ऐसा हुआ. नेक्स्ट सर अगर वो लेग पेन बताइए कि लेग में एडिमा है तो उसका रीजन क्या है. उनको ये बताना चाहिए कि ये कॉमन है, फिजियोलॉजिकल चेंजेस होते हैं, तो इसकी वजह से इसमें आपको डरने की जरूरत नहीं. उस चीज़ को नेगलेक्ट किया. आफ्टर सर नेक्स्ट सर लास्ट में उन्होंने बताया कि सर एक और था.
ओके गुड. नहीं, आपने बहुत ही अच्छे पॉइंट्स कहा. मुझे समझ में आ रहा है कि
फोटो तो सर कम्युनिटी एरिया में सर होता है. सर ये एज अ कम्युनिटी हेल्थ ऑफिसर मैंने वर्क किया है. मैंने ये चीज़ देखा है सर, जो सुपरविजन के लिए जाते हैं सर, जो CHO जो होते हैं, एनम होते हैं, वो उनका मेन फोकस होता है फोटो क्लिक करना, जिसे उनको ग्रुप में डालना होता है. तो वो जाते हैं, अपना वर्क करते हैं, थोड़ा वर्क करते हैं और ज़्यादा से ज़्यादा तो उनका ये होता है कि फोटो क्लिक करा, अच्छा ग्रुप में चले, ठीक है, अटेंडेंस लग गई है. तो सर ये नहीं होना चाहिए, क्योंकि सर इससे बैड इम्पैक्ट पड़ता है. जो सर वो करते हैं उनको भी लगता है कि अब वो फोटो ही क्लिक कराएं, आपको बता देंगे,
तो थोड़ा ट्रस्ट कम हो जाता है. बहुत अच्छे पॉइंट्स कहा आपने. अच्छा लगा कि आप कह रही थी एक कि आपने भी ये पॉइंट कहा कि फोटो के बारे में, राइट, और प्लस कि उनको सेंसिटिवली समझाना चाहिए कि ठीक है आपका एडिमा है पैर में, बट ये नॉर्मल है, उनको थोड़ा तसल्ली देना चाहिए. एक्सेलेंट, वेरी गुड, बहुत अच्छे सजेशन.